2 of the Global Pharmacy Technicians Symposium. And welcome to everyone joining us live right now, as well as those of you who are listening in afterwards to the recording. I'd also like to welcome our speakers and moderators for today, who you'll hear from very shortly. Our symposium this year is titled Working Together for the Future of Healthcare, and I think you'll hear that throughout the sessions today. My name is Ryan Burke. I serve as the Senior Director of Professional Affairs at the Pharmacy Technicians Certification Board in the United States, and we are the largest credentialing body for pharmacy technicians here in the US. Before we begin, I have a few important announcements to share with you. Please note that this event is recorded and live streamed on the FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and we will do our best to manage those questions as they come in and make sure the speakers have a chance to address them. You're also welcome to provide your feedback to webinars@fip.org. And I would also like to mention that if you're not already a member of FIP, we encourage you to join. You can see the link there at the bottom of your screen. There are many benefits, regardless of whether you're a pharmacist, a pharmacy technician, a pharmaceutical scientist, and I encourage you to take a look at all that FIP has to offer. We have a really great program lined up for you today. We'll have 2 sessions. The first will be focused on building relationships within the pharmacy team. And the second will be focused on immunization administration services and the role of pharmacy technicians in doing that. And then we'll hear from Susan James, who's the chair of the Pharmacy Technician Advisory Committee, to wrap up today's session. So with that, I will kick off the first session of the day, which is entitled Building Relationships Within the Pharmacy Team. This session will focus on enhancing collaboration and communication among pharmacy professionals and explore strategies for fostering trust, respect, and effective teamwork in various pharmacy settings. Our excellent speakers will discuss ways to improve intra and interprofessional relationships and create a supportive work culture. There are 3 learning objectives for this session. The first is to understand the importance of those intra and interprofessional relationships. The second, identify opportunities to foster trust and respect within the pharmacy team to build a supportive work culture. And finally, develop skills for improving intra and interprofessional relationships to ensure effective collaboration and patient care. We have 3 speakers for this particular session. First, we'll hear about leading pharmacy technicians and some of the research and evidence around the best approach for doing so. And then we'll hear perspective from the UAE about building relationships from the pharmacy team. And then we'll hear from FIP Professional Secretary on some of the work that FIP has done in this area as well. And as I mentioned before, there will be time at the end of this portion of the session to have your questions answered. And so if you think of questions throughout the speakers' presentations, I would encourage you to submit those in the Q&A, and we will manage those toward the end of the session. So with that, it's my pleasure to introduce our first speaker, Kenneth Hohmeier. Ken Hohmeier is a professor and director of community affairs at the University of Tennessee Health Science Center College of Pharmacy in the United States. He also serves as vice chair of education within the college in the Department of Clinical Pharmacy and Translational Science. Dr. Hohmeier has an extensive background in pharmacy practice and practice-based and implementation science research, including postgraduate residency training in community pharmacy, Lean Six Sigma, Change Leadership, and Implementation Science Institute. He has successfully established clinical pharmacist services within several community pharmacy settings. His background also includes extensive leadership experience with past and current positions held at local, regional, and national levels, including the American Pharmacists Association, Ohio Pharmacists Association, and Tennessee Public Health Association. His areas of research include clinical service implementation in community pharmacy settings, medication therapy management, and innovative clinical pharmacy practice models. He has served as a principal investigator or co-principal investigator on over 20 grant-funded projects, most of which explore expanded roles of pharmacists and pharmacy technicians in the community pharmacy to increase patient care activities such as vaccinations, MTM, and other clinical services. To date, Ken has authored over 110 papers published in peer-reviewed journals and 15 textbook chapters. Ken wasn't able to join us live today, but he was gracious enough to record his presentation for us, and so I will share that with you now.
Well, greetings everybody. Thanks for the opportunity to present here today on leading pharmacy technicians and evidence-based approach. My name is Ken Hohmeier, and I am a professor and vice chair in the Department of Clinical Pharmacy and Translational Science at the University of Tennessee Health Science Center, and I'm located on the Nashville satellite campus, which is in the middle of the state of Tennessee here in the United States. A few objectives here for our discussion. We are going to describe the evidence surrounding pharmacist leadership of pharmacy technicians. We'll want to differentiate between leadership approaches and leadership behaviors. So we'll talk about general leadership styles and then get into the leadership behaviors, which are discrete actions within a more broad approach or leadership style. And then finally, we'll get really practical, and we're going to list pharmacist leadership behaviors associated with positive pharmacy technician perceptions. Again, all of this will be based in either existing or emerging evidence. So we'll kick off this conversation by simply stating that pharmacist leadership matters. Pharmacist management styles and leadership styles are associated with a variety of quality of work-life outcomes, including willingness to take on new roles, turnover, general quality of work-life measures, and then overall quality of patient care. And so a more positive perceived management style increases these things. Willingness to take on advanced pharmacy technician roles, for example, like technician product verification or tech. It reduces turnover. It increases commitment to a organization. Supportive pharmacist supervisors are associated with also a reduction in stress and future uncertainty, and an enhanced coworker support and organizational commitment measures. So there's a variety of these outcomes which the evidence supports to, that points to, that say that a pharmacist leadership, the way that a pharmacist leads, has these really important impacts on the pharmacy technician. And this is, of course, has always been important, but in a post-pandemic world where we've seen an increasing number of pharmacy technicians turn over from one organization to another, or simply leave the career of being a pharmacy technician altogether, it's really crucial that we not only look to support the pharmacy technicians from a human resources or organizational structure point of view, but also in building up the leadership styles and quality of leadership of our pharmacists. So that begs the question then, what type of leadership approach is most beneficial, is most associated with some of the things I listed on the previous slides? So let's go to the evidence when we're looking at what style of leadership is most beneficial for pharmacy technicians, most associated with some of these outcomes that we had just discussed. And the evidence shows us that there is benefit to a transformational leadership approach by pharmacists. Now, to understand what transformational leadership is, we will contrast that with transactional leadership approaches, which are often found in leaders of every sort, but particularly in pharmacy. Transactional leadership is the goal for that is compliance. Targets are the behaviors of the employee or the direct report. Our rewards here are pay and promotion, and the preferred tool to achieve the desired goal or outcome is really by evaluating that individual. That's transactional leadership. Again, very status quo, things that, in and of themselves are not bad things. But what the broad research, the existing evidence base is around transactional and transformational leadership is showing us is that transformational leadership takes those leadership style and leadership approaches and builds on them in a way that has even higher, greater impact on some of these quality of work life measures. So then what is transformational leadership? Transformational leadership is goal of a commitment to the organization, commitment to the leader. The targets here are not specific behaviors, they're attitudes, they're values. The reward here is a little bit softer. It's self-esteem and it's pride. And the preferred tool is not evaluation, it's development. So again, this isn't to say that a transformational leadership approach is the only approach that a leader can use. Individuals who are transformational leaders also use aspects of transactional leadership. However, those pharmacist leaders in particular that use a larger degree of transformational leadership levers here that we have listed on the screen, you'll see in the orange box, are associated with less future uncertainty and more professional or employer commitment. And this comes from a recent research paper published by DeSalle and colleagues in 2022. So again, it's not to say that transactional leadership in and of themselves is a bad leadership approach. But it is to say that those pharmacist leaders who use transformational leadership more often have a higher association with technician teams that have less future uncertainty and more professional employer commitment. And so again, the nuanced difference in the approach there. More information can be found on transactional and transformational leadership in a lot of different sources throughout the evidence base. There's lots of primary literature on this, lots of review articles, and I reference here a foundational paper on transformational and transactional leadership. But when you're looking at this, even if you start to dive into the literature, the question is, though, how does this impact the frontline pharmacist? How does this actually impact the way that either I manage or that I teach my students or my pharmacist team to manage their technicians? And so in the next couple of slides, let's talk a little bit more about the behaviors, the specific behaviors that make up transformational leadership. So, of course, that begs the question, what leadership behaviors, though? What are the specific, discrete leadership behaviors which will support our pharmacy technicians so they can achieve all the wonderful things that we know that they can do within a pharmacy organization? So here I'd like to share some preliminary results of a project that we have going on with a large supermarket pharmacy chain in Tennessee. This is a nationwide supermarket, but we dealt specifically with a region within that national chain local to Tennessee in the United States. There was a couple of different methods we used here, really in a mixed methods manner. The first thing we did was we had a cross-sectional survey done of the pharmacy technicians in the supermarket chain. That survey involved a questionnaire which really assesses a lot of things, but primarily we're looking for transformational versus transactional leadership. That's the MLQ, the questionnaire for multifactorial leadership. We also assessed resilience and retention and organizational commitment, really to look for associations between leadership style and these other factors, which we already had a good understanding of how those things influenced each other based on the previous DeSell article. But there was also another reason, besides just looking at these associations, that we wanted to survey the technicians. And we'll talk about that on the next slide. So what we did after we surveyed those 22 different pharmacies, and what we found were, as you'd imagine, a range of different responses across those 22 pharmacies. And what we could do is then take those 22 pharmacies and break them down into sections. Those who had the MLQ scores, which demonstrated high degrees of perceived positive leadership, and those with lower scores, lower degrees of technician perceived positive leadership. And so we broke them into tertiles. We had first thought we were going to break these into quartiles, but when we looked at the data, tertiles made more sense. And so we had a top tertile and then a bottom tertile. And what that allowed us to do then, and this is where the mixed methods came in, was we began to do interviews and observations at those top tertile and bottom tertile pharmacies. Again, to look at, all right, so we know what general leadership approaches tend to have better outcomes for our pharmacy technicians, but what are the discrete behaviors that are happening in pharmacies? And again, we did that exploration through observation, so actually standing there filling out a standardized observation form, and then conducting interviews with the pharmacy technicians in an anonymous way, in a way where it was a non pharmacy employee researcher who did the interviews in a really safe environment to ask some really important questions about what is it that you feel your pharmacy manager is doing as it relates to leadership behaviors. And this is what we found. So on the left-hand side of the screen, you'll see the top tertile pharmacist leader behaviors, and on the right side, we'll see the bottom tertile pharmacist leadership behaviors. And this is data that came through a qualitative analysis of both the interviews and the observation form. Top tertile pharmacists here, so this is what we want to achieve, the behaviors we want pharmacy managers and leaders to have. Those pharmacists themselves delegated to the technicians. They didn't have somebody else to do it. They were the individuals who delegated directly to their team. They also taught their technicians how to prioritize tasks. They didn't do the prioritization themselves. They taught them what is most important based on the priorities of the organization or the pharmacy itself, or maybe the patient population, but they taught the technicians how to prioritize. They set clear expectations from the beginning. They also focused on autonomy of task completion, or sometimes this is called stewardship delegation. It's a different type of delegation from, hey, go do this or go do that. This is, hey, I want you to be the person who is in charge of inventory. I'm going to show you how to do that. I'm going to teach you how to do it. I'm going to show you what I'm looking for with my clear expectations, and then it's going to be up to you. You decide, based on your workload, when it's best to do inventory management. You decide how to do it the best. You decide what forms to use. A level of autonomy in there. And then, hey, go forth and do that thing. They also focused on technician development, and that's going to sound very familiar because we talked about that in transformational leadership, right? This idea that the tool is really building up the individual. And then they tried to build a team environment. They had a focus on team environment. The bottom tertile really was the complement to the top tertile behaviors. In the bottom tertile leadership behaviors, we see the senior technician, maybe the person who's been there longest or has the largest credentials, being the person who delegated to the technician team rather than the pharmacist. They sort of had somebody else take care of that for them. The tasks were prioritized by another person, not the technician themselves, either by the senior technician or by the pharmacist, and then delegated down the line. They only gave direction when a problem arose. So they waited until a technician made a mistake and then pulled them aside, sometimes in front of the entire team, but usually pulled them aside and said, hey, don't do this next time. Rather than saying, here's what to do, and then just sort of saying, you're doing a great job of doing those things. They waited for the mistake to be made, and then they used it as a point to educate or to teach. There's a higher degree of micromanagement, a focus on task completion, and a competitiveness amongst the team, really based on the behaviors that are on top of that behavior, created a competitiveness rather than a working together team environment. And so in summary, to support our pharmacy technician teams, we have to remember that pharmacist leadership matters to pharmacy technician success, and that transformational leadership styles preferred over transactional, and that there are these specific, discrete leadership behaviors of transformational pharmacist leaders that can make a difference, including developing the technician teams, stewardship delegation with autonomy, and really developing a team environment. I thank you for your time today, and would encourage you to reach out to me, and my email is up here on the screen if you have any questions or desire to collaborate on work like this in the future. Thanks so much for your time and attention.
Well, I want to again thank Ken for recording his presentation for us. As he mentioned, his email is there on the screen. So if you do have questions for Ken, you are welcome to reach out to him directly and collaborate if there are opportunities to do so on additional research in this area, if that's of interest to you and your respective organizations. So it's now my pleasure to introduce our next speaker, Dr. Juny Sebastian. Dr. Sebastian is currently an assistant professor and acting chair in the Department of Pharmacy Practice at the College of Pharmacy, Gulf Medical University in the UAE. After completing her education in India, she relocated to the UAE in 2022. As an active researcher, Dr. Sebastian has successfully coordinated numerous research initiatives, including multi-country collaborative vaccine safety studies for the World Health Organization and various clinical trials for drugs and vaccines. Throughout her career, she has built an impressive portfolio with over 70 publications in peer-reviewed journals and more than 30 scientific presentations at both national and international conferences. Dr. Sebastian has been pivotal in the development and recognition of the Diploma in Pharmacy Technician program at Gulf Medical University, where she also serves as the director of the program. Dr. Sebastian, thank you for being here today. We look forward to hearing your perspective.
Thank you, Ryan, for giving a nice introduction. So I would like to discuss about the topic, the building relationship within the pharmacy team. So before I begin, I would like to say good morning, good afternoon, and good evening to everyone who are joining from around the globe. Okay, so my session, I'm going to discuss more about the pharmacy technicians in the UAE. Can I have the next slide, please? Yeah, before I begin, I would like to highlight the vital role of pharmacy technicians. So I would like to say that behind every pharmacist is a great pharmacy technician who ensures that no detail is missed. See, pharmacy technicians are the backbone of pharmacy operations. Their precision in tasks such as receiving medications, preparing medications, managing inventory allows pharmacists to concentrate on clinical responsibilities. Pharmacy technicians play a crucial role in streamlining pharmacy workflow. By handling essential yet time-consuming tasks, they reduce the burden on pharmacists, allowing them to dedicate more patient care as well as clinical decision-making. Attention to detail is one of the core strength of pharmacy technician. They ensure that every step of the medication management process, from documentation to dispensing, is carefully carried out with precision, minimizing errors and enhancing patient safety. Can I have the next slide? So coming to the situation in United Arab Emirates. So in United Arab Emirates, there are 4 approved professional categories of pharmacy: the clinical pharmacist, pharmacy technician, and pharmacy trainee. So as you all know, to become a pharmacist, each candidate need to have a graduate degree and 2 years of training experience. So to get a training experience, you can register yourself as a pharmacy trainee. And if you are working as a pharmacist, if you are working as a pharmacist for a period of minimum 2 years in a clinical or a hospital setting with some specialty, you will be eligible to register yourself as a clinical pharmacist. So obviously, there are some exams and other things you have to complete prior to your registration. Can I have the next one? Yeah. So according to the pharmacy guidelines, which is released by the Ministry of Health and Family, Ministry of Health and Prevention, each licensed pharmacy shall appoint and maintain adequate number of qualified pharmacists and pharmacy technicians to ensure reliable and consistent service in compliance with the pharmacy standards. The next slide, please. Yes. So the pharmacy technicians in the UAE, if anyone wants to work as a pharmacy technician in UAE, they need to have a minimum, they need to have a diploma in pharmacy program, a graduation, with minimum 2 years of experience. And the condition for the diploma in pharmacy program is that the program need to have a duration of minimum 2 years following the high school degree from a recognized institution. Can I have the next point? So if you look into the pharmacy standards by Quality Improvement Department of Government of Dubai, they clearly specified the ratio of a licensed pharmacist to pharmacy technicians must be at least 1 licensed pharmacist for every 2 licensed pharmacy technicians. So there is a sufficient number of pharmacists and double the number of pharmacy technicians are required in UAE to offer the healthcare needs of the country. Can I have the next slide? So keeping this, here we are discussing about the role of pharmacy technicians in UAE. So which are the roles permitted by the ministry for the pharmacy technicians? The first one is receiving and checking prescriptions, preparing medications for patients, dispensing under the supervision of a licensed pharmacist, helping with insurance claims and handling patient paperwork, stocking, pricing, and taking inventory of medications, maintaining hygiene and cleaning protocols, equipments, and supplies, maintaining cash registry in pharmacies, and participating in pharmacovigilance activities, which is a recently added role of a pharmacy technicians in the UAE. Can I have the next slide? So keeping all these roles of the pharmacy technicians, we at the Gulf Medical University, we created or developed a diploma in pharmacy technician program. So this is the first program of its kind in United Arab Emirates. There were no other universities offering these kind of programs until last year. So we got the approval from the Vocational Education and Training Center through the National Qualification Center. We got the approval in 2023. So the first batch of students are in the second year of the diploma program. So as I told you before, the pharmacy technicians need to have a diploma of 2-year duration. So our program is having a 2-year duration and with 90 credit hours of teaching work. And it has a workplace training modules and other modules, which is exactly matching with the roles which the pharmacy technicians were doing. This is a level 5 program, and it is offered over 4 semesters and 2 summer terms. Can I have the next slide, please? So what we did, we have looked into the national and international universities and institutions which offer the diploma program. And we have seen, we have observed, or we have reviewed the programs offered by the universities in Middle East, universities in the Canada, US, UK, and various other organizations. So we carefully crafted 8 program learning outcomes for this diploma program. And we have reviewed UAE pharmacy guidelines, as I explained before. We have seen ISCO documents. We have seen ONET requirements. We have seen ASHP accreditation standards of pharmacy technician, education training program, and the National Competency Framework for Primary Care Pharmacy Technicians endorsed by the Royal College of General Practitioners. So by reviewing all the different programs and the program learning outcome, we come up with 8 program learning outcomes. So the first one was to incorporate biomedical knowledge to drug use. The second one is about the compounding, perform pharmaceutical compounding, dispensing and administering medications under the supervision of pharmacist, and prepare medications for dispensing to patients based on the prescriptions and medication orders with necessary dose calculations and instructions, assist pharmacy operations, including inventory control, communicate professionally with the patients and the healthcare team, ensure compliance with the regulatory requirements at the technician level, engage in value-added services at technician level in providing the value-added services through the pharmacies, demonstrate mutual respect, self-awareness, and continuous professional development. So I would like to draw your attention to the topic of the day, which is building relationship with the healthcare team. You can see most of these program learning outcome has an interlink with that particular team. So working closely with the healthcare team is one of the program learning outcome which we are expecting through these diploma program. Can I have the next slide, please? But there are some limitations for pharmacy technicians at UAE. So the pharmacy technicians must not involved in some of the activities which are receiving or nor dispense narcotic, psychotropic, or semi-controlled medicines, dispense prescription-only medicines, counsel patients, or direct interaction with the patients, basically. We assign the role of qualified person responsible for pharmacovigilance. You might have seen in my previous slide that they are responsible for pharmacovigilance activities, but they cannot be the qualified person responsible for pharmacovigilance, or otherwise we call it as QPPV. Enter information in psychotropic, semi-controlled, or narcotic medications, and perform any pharmacy task that may require prior knowledge of pharmacotherapy or pharmacology, including but not limited to the assessment of patients or any drug therapy plan or interpreting the clinical findings. Can I have the next slide, please? Yes. There is a strong teamwork needed to work in the pharmacy. So the collaboration between pharmacists and pharmacy technicians is a key in developing safe and effective, in delivering safe and effective patient care. By working together, they ensure that medications are dispensed accurately and patient needs are met promptly. Pharmacy technicians allow pharmacists to focus on more clinical tasks by handling administrative and operational tasks. Pharmacy technicians play a supportive role in making healthcare delivery smoother and more collaborative. A successful pharmacy team is built on trust, respect, and clear communication. Pharmacy technicians and pharmacists must work together seamlessly, as their combined efforts are what drive the success of the pharmacy and improve patient care. Can I have the next slide, please? So the future vision of pharmacy technicians, specifically to UAE, if I say, the first one, I would like to highlight the need of professional development. At the moment, the Ministry of Health, they already insisting pharmacy technicians to have a continuous professional development, which is amounting to 30 credit hours for activating their license. But there is a real need of providing a continuous professional development, specifically on the teamwork, updating the knowledge, and etc. So that is very important for the pharmacy technicians. And role expansion is another important thing which we have to look in. As healthcare system evolve, pharmacy technicians can take on more advanced roles on drug dispensing, adherence monitoring, patient counseling under the supervision of the pharmacist. Expansion into clinical roles, including supporting pharmacists in hospital setting, assisting patient care rounds, contributing to medication reconciliations and safety initiatives are also to be considered. And the pharmacy technicians can increasingly contribute to the digital health initiatives, such as managing a pharmacy information system, automated dispensing system, and tele-pharmacy services, etc. And the last point is vision for the UAE. Hope you know the audience know the situation of United Arab Emirates. There is a global population living in here. We have a global culture. And as I told you before, there were no pharmacy technician programs available in UAE. There were previously. So all the pharmacy technicians working in the UAE were expatriates, and there were very limited or no pharmacy technicians of UAE nationals. So now the UAE government has come up with the strategies to increase the UAE national pharmacy technician workforce. So with the support of the ministry, we initiated the program, and the government is supporting all the UAE nationals who are joining the program through scholarships. So the UAE has a NAFIS program for strengthening the human workforce of the country. And they are supporting the students who are joining for the program through scholarships and the merit-based incentives. So there is a huge vision from the UAE to increase the pharmacy technicians' workforce within the country. So pharmacy technicians in UAE are crucial to address healthcare challenges such as growing demands for service, ensuring quality control, and optimizing medication safety. With proper training, pharmacy technicians in UAE can take expanded responsibilities such as patient counseling, assisting in vaccine administration, which we are going to hear from in the next session, and contributing to different public health initiatives. So as an ongoing effort, along with the Gulf Medical University, the other institutions are also going to release or come up with the pharmacy technician programs. And similar initiatives across UAE will serve as a foundation for elevating the profession, driving policy changes, and expanding the scope of practice for pharmacy technicians in the country. Preparing pharmacy technicians to utilize emerging technologies such as artificial intelligence in drug dispensing, robotics, and patient care management are also need to be looked in while thinking about the pharmacy technicians. Can I have the next slide? So to conclude, I would like to say strong collaborative relationship within the pharmacy team are essential for delivering high quality patient care and ensuring efficient operations. Investing in the ongoing development of pharmacy technicians and fostering interprofessional collaboration is crucial for improving patient outcome. Together, through the teamwork and communication, we can shape a more resilient and patient-centered healthcare system for the future. Thank you, everyone.
Thank you so much, Dr. Sebastian. I wrote down several things that I want to ask you when we get to the Q&A. It was a very informative presentation. And I think it's really great to hear that there is a recognition and goal to really invest in the pharmacy technician workforce. I know that is something we're experiencing here in the US in terms of a shortage, and I understand that that's happening around the world. And so it's really good to hear that there's sort of an understanding of that and some work to really invest in the future of the technician workforce. So more to come when we get to the Q&A part. Thank you again for sharing your expertise with us.
Thank you.
All right, now I'll introduce our final speaker for this session of the day, Luís Lourenço, who is a community pharmacist from Portugal. As I mentioned earlier, Luís is a member of the board of the Portuguese Pharmaceutical Society and has been serving as FIP Professional Secretary since 2019. And together with his colleague Jill Boone, he is the co-chair of the FIP Policy Statement on Interprofessional Working. And so, Luís, we appreciate you being here and look forward to hearing about some of the work that FIP has done in this area.
Thank you, Ryan. Thank you so much for your words. And good morning, good afternoon, or good evening to all participants on this event. I hope you have been enjoying so far, not only today but also yesterday's symposium. I'd like to also to thank the kind invitation that was sent by PTAC, the Pharmacy Technicians Advisory Committee of FIP, to be here today and to celebrate World's Pharmacy Technicians Day that was held yesterday. So I'm very happy to be here. If I just move forward with the next presentation. Next slide, sorry. When it comes to building relationships within the pharmacy team, of course, we have different stakeholders. And of course, you have practitioners who are working in the field. We have local, national, and also international organizations. So each one of these stakeholders have a role to play regarding these relationships and to help or to foster building those relationships. And my focus today is actually to share with you what's been going on FIP regarding this topic and how important it is. If you move forward with just the 3 clicks, welcome to see the 3 main areas that are going to be focused today. The first one is related with governance. So FIP, both externally, internally, and when it comes to internally, also regarding its vision, has a focus on this interprofessional and interprofessional relationship. And so what I will showcase is that what has been done and what's been going on regarding how do we set this governance in order to foster relationships. There's also a part we'll focus on data collection and also data sharing, because it's important to collect not only the best practices, but to be perceived as a repository of information that if you want to move forward with an advanced practice relating to professional relationships, FIP can be a trustworthy resource center for that. And at the end, and this is not my level of importance, just so for the sake of organization, I'll focus also on what I've been doing regarding the statements of policy. Of course, the FIP can have an active role on establishing or to have updated practices or to change in practice. But what is our actually major role is to set a vision and to provide some guidance to all other stakeholders just to move forward with advancing in practice. So if we move forward to the next slide, we'll see how come FIP is changing or is adapting its governance, especially on external issues. I want to introduce you, for those of you who don't know, the World Health Professions Alliance. That, as it's here mentioned, it was formed in 1999. And if you move forward with the next click, we also see that WHPA right now englobes more than 41 million healthcare professionals from all over the world, from more than 130 countries, which is something amazing. It's a forum that we have been involved in right now. Our CEO, Dr. Catherine Dung, is also the CEO of the Secretary General from WHPA. So we have in this organization a structure where they actually exchange some ideas about how can we foster interprofessional relationships, how can actually have a common voice regarding what healthcare professionals would like to have in the future. And that's been very fruitful. I had the opportunity last month to attend the International Dentistry World Congress that was held in Istanbul. It was really impressive because when I was doing my presentation, and I mentioned that at the early beginning, is that I mentioned to all participants, at the end of this, I'm sure you'll just realize that pharmacists and dentists actually have more things in common than in opposites. So it's important to have this in our mind that sometimes you need to understand what's our role. Of course, I'm talking about other healthcare professionals, but also intra the pharmacy team, what's our role, and to be clear about that. So FIP is putting a lot of effort on these external governance structures in order just to foster the relationship between professionals. Now, if you move forward to the next slide, you will see what's actually being done internally. As I mentioned, this symposium is being organized by PTAC, the Pharmacy Technicians Advisory Committee, which actually is a structure that was built on top of other one that was the Pharmacy Technician and Support Workforce that was established back in 2011. Just for you to have an idea that within the structure of FIP, within the governance of FIP, we do have the voices of pharmacy technicians in order for us to have an embracive view about what can be done to be working together. And then if you move next to the next slide, you also see that FIP has been setting set in 2021, the FIP development goals. It's a framework. For those of you who are not aware of it, it's a framework of goals, of wishful achievements that we would like to have within our profession. And then if you just have another click, you will see that in goal number 8, it's working with others. So there's actually a specific goal within the overall strategy of FIP regarding pharmacy development that is working with other professionals. And there we actually have a perspective, not only from the science point of view, but also from the practice and from the education and the workforce development. So FIP is actually setting what should be done regarding this domain of working with others. Of course, that we know that on the rest of the 20 development goals, we do have some involvement of other professionals. But the thing is that it is so important for the profession and for the overall provision of healthcare that we do have a specific goal just focusing on working with others. Then we finish this part of the governance and we move forward to the next slide for the data collection part that was mentioned previously. So data collection is important because as an international organization, as an umbrella organization, we're able to interact with different national and local stakeholders. So we do take the responsibility of collecting the best practices, collecting all the information on a regular basis. So of course, it's not just for the sake of collection, it's actually for the sake of sharing that information. Imagine that you are in your own practice, that you are in your own jurisdiction or in your own country, and would like to know what's going on worthwhile. This FIP can actually provide you some views on that. And then if you click forward in this slide, you actually see some of the reports or some of the documents that have been prepared. We do run surveys. We do prepare educational tools. In our next slide, you'll see also some reports that have already been prepared regarding the pharmacy technician's role and the way that we as a pharmacy team interact amongst each other. And then you move forward to the third pillar, or probably the third area that FIP is really focusing a lot regarding practice development, is related with the statements of policy. So if you move forward with the next click, you will see that we started working in this topic, but well, probably way before that, but officially we do have the statement of policy on collaborative pharmacy practice that was dated back to 2010. It was the first written document that we have that is stated how actually pharmacists and other professionals are working in the pharmacy team and other professionals working outside of the pharmacy team, but actually focusing on healthcare should actually working with each other. But that statement of policy evolved, and in our next slide, you'll see that FIP worked together again with the WHPA, the World Health Professions Alliance, setting a statement on interprofessional collaborative practice. So the idea was not only to focus on the pharmacy team, but to have something broader, in a way to give some broader guidance about how important it is to work with other healthcare professionals. And then in our next slide, you also see that this statement was updated. Oh, sorry, that was a previous one that was mentioned. It was updated. Sorry, thank you so much, Ryan. It was updated in 2019, but it came to the conclusion a few years ago that although it's important to have a common statement of policy with other professionals, it's important to focus more on our internal issues. So that's how we move forward with our work. In our next slide, we'll see that back in 2023, during the FIP annual Congress, during the council meeting, it was decided to set a working group to work on the policy statement on interprofessional working. So if you move forward with the next slide, we'll see that reference. And actually, that was the working group. I was working with Jill. That kindly just accepted the invitation to co-share this working group. And then I'm very happy to announce, because I've already shared some of this information a few months ago, also on an event for pharmacy technicians, that the statement was going to be presented during the FIP annual Congress that was held in Cape Town late August this year. But now I'm very happy to announce that the statement was actually presented and approved at the council meeting in Cape Town. So in our next slide, what we'll see is the structure of this statement of policy. Of course, that's important to set first of all, the basics about what is interprofessional collaboration, interprofessional work, what are the best practices, how does WHO perceives this collaborative practice. In a way, there's a part that is set under the introduction, focusing on the basics of interprofessional collaborative practice. But then we move forward to actually have a sort of a call for action. So it's not only a statement focusing on policy, overall policy, but also how can the different stakeholders can actually have a role on developing the collaborative practice. And now we move forward with section A, section B, section C, that focusing on government and policymakers, on academia, on pharmacists, but also an FIP. So in a way, FIP, although it doesn't have the mean to build relationships locally, or even in our own practice, it does give some guidance about what can all of us do as the different stakeholders just to move forward with actually having more people working together. So at the end, and that will bring me to my last slide as a sum up, just please keep in mind an FIP is adapting its internal, external, and also its vision to actually embrace intercollaborative practice within their own structure. We will keep on doing our data collection, but please feel free to reach us to get some more information. There's no point of having this information if you don't share it to people who will need it. So we'll keep on being a repository of all this information. And of course, we now actually have said, we have a statement of policy, and we have said to our partners, to other stakeholders, well, we would suggest you to do this, this, and this, but, and that's the most important part, FIP is also committed to do more regarding intercollaborative practice. So that brings me to my last slide. Thank you so much for your attention. I'll leave you here with my email address. Of course, I'm open to any questions you may have. So Ryan, I'll give you back the floor. Thank you so much.
Thank you, Luís. It's great to hear about all the important work that FIP is doing in this area. So at this time, we have time for a Q&A session with our speakers, Luís and Juny. And so I would ask, I'm going to go ahead and stop sharing my screen at this time. And I would just ask Juny to rejoin us on camera. And we'll give her just a moment to join. All right. Well, again, thank you both for sharing your perspective. And I want to encourage the attendees to submit their questions in the Q&A box so that we can get to those as they come in. I did write down a number of questions for both of you that I think we can have a bit of a conversation on. And I'll start with you, Juny, around, you mentioned in one of your slides that one of the pillars of the pharmacy technician training is around communicating professionally. And I know that that can sometimes be a difficult skill to teach. And I'm wondering, what have you done in your program to impart that skill on the people who are going through it?
Yeah, we have created that as a program learning outcome itself, and we have created a particular module on professional communications, where we are having more of practical activities, which is encouraging them to encouraging the pharmacy technicians to talk to the patients and talk to the healthcare professionals. And we have activities created for all this. And we have incorporated a few weeks, which is dedicated purely for the interprofessional education. Our university is having multiple programs. We have medical programs, dental programs, nursing programs, physiotherapy, and many other healthcare programs. So we have created the interprofessional student groups, and they are doing the groups together. We are created a groups, and they are preparing, or they are learning from each other. So all these activities are helping them to improve their communication skills, and specifically professional communication.
Thank you for sharing that. We experience this here in the U.S. as well, where especially when we think about standardized exams, which is what we use in the U.S. to assess knowledge and competency. It's really hard to measure whether someone is good at what we consider to be those soft skills of communicating with others. And so it's great to hear that you've come up with some techniques and strategies to incorporate that into your own program.
Yes, for assessing, we even follow OSCEs and OSPs for assessing the communication skill. This is not a written program. This is a purely skill-based program, and the evaluation is in that way, practical.
Yeah. Well, thank you for sharing that. Luís, I was wondering if you could speak a little bit more to WHPA. And do you have any examples of some of the recent work that you might be able to share? And if there's anything specific to the pharmacy technician workforce that might be of interest to the audience?
Thank you, Ryan, for the question. So what we're actually doing within WHPA is discussing right now is a hot topic about the role of the different healthcare professionals. We are seeing that not only nowadays, but we do perceive it, we just do know that in the future that will happen, that we will have a shortage of healthcare professionals. So what we're discussing within WHPA is that we need to foster task sharing and task shifting, because it's not bearable just to have people living more years, and we hope that they live with more quality years. And although we do have more people coming into the field, we have more healthcare professionals, we'll keep on having a shortage because it's not balanced, the number of people that need our assistance and actually number of healthcare professionals. That comes also to the role of the rest of the pharmacy team, because what we're seeing is that we will see some healthcare professionals sharing their skills, but they will have to actually shift them. And then that's how we come with the technician, because, well, it's impossible also to pharmacists that when they're embracing new areas of practices to actually keep on having all their skills just focusing on them. So we'll need more and more the assistance of pharmacy technicians just to perform different roles. And I can actually pinpoint right now what will be the trend, because what we're seeing that countries work in a very different way. For instance, in the past, like before the pandemic, in France, it was not possible to vaccinate within community pharmacies. But during the pandemic, there was a shift on the regulation, and pharmacists started to vaccinate, and pharmacy technicians also started to vaccinate. And then suddenly, in 1 year and a half, in 2 years' time, there was a huge shift on a single jurisdiction regarding the role of pharmacists and the pharmacy team. So that can happen suddenly in another jurisdiction with other areas. But just for us to keep in mind that we have a world of opportunities, and for the sake of our patients, we'll have to foster the way that we work and focus not only on task sharing, but also on task shifting.
Yeah, and obviously our next session will cover the sort of the growth of technicians being engaged in immunizations. That's something we've seen here and in other parts of the world. And the COVID-19 pandemic really spurred the necessity, I think, for that task shifting that you are talking about.
Mm-hmm.
I'm wondering, and I'll pose this question actually to both of you, and maybe Juny, you can go first, which is when we think about task expansion or task shifting and giving pharmacy technicians more responsibility, I'm wondering if in any of the work that you've done, have you encountered opposition to that happening? And how do you overcome that opposition or persuade people that this is the right direction to head in?
Yes, there is a significant apprehension from the pharmacist side for the pharmacy technician to take over these responsibilities. They worry whether their roles will be taken over by the pharmacy technicians. But as there is a significant shift happening on the pharmacist roles, where we are shifting from the traditional role of dispensing to more of patient care, extra value-added services, and other things, we can have pharmacy technicians taking up some of the responsibilities or a role expansion, which can be possible at the moment. So, but the thing is, they need to have a continuous professional development or have an upgraded knowledge for performing this. So definitely with supervision, they can be given with these some of the tasks of patient interactions, obviously under the supervision, but we can definitely give that. And we have to expect these apprehension, and we have to have a common understanding on how can we implement this.
If I'm just to add, I think it's important to keep in mind that we do have different jurisdictions, and the role of technicians and pharmacists is very diverse worldwide. I'm sure a lot of participants here are saying, well, I never thought that the pharmacy technician to do this or that, or even a pharmacist. So it's important to, first of all, well, when we discuss about how the pharmacists perceive this change in practice, you need to perceive that we did have different cultural issues and also some different regulatory issues. But when it comes to working with others, of course, I'm not an expert on that, but I do rely on the expertise that we have within FIP, mostly on pharmacy education and practice, is that we need to, first of all, have clear regulations about who does what, and the perception of the supervision in some of the tasks. Because sometimes what we see is that there is no clear view about how do we work together. And when something is very blur, we just say, well, whoa, I'm just getting into this or into that. And sometimes it's very uncomfortable because people do not know where are the boundaries. That's the first step. And the second one, actually is very important, is building trust, the way that we interact. And that's something that comes with the teams, comes also with the culture, not only of the country, but also from the area, how people see others to be working with. And to be honest, what we see with pharmacy technicians in a pharmacy, we also see with pharmacists and other healthcare professionals, has to do with human nature. So I was very pleased just to hear what Kenneth just came up with, his approach regarding leadership. All comes to the fact that we are all humans. We want to have our comfort zone, but we need to have some path and follow some guidance to achieve a certain goal. Of course, and my third point I would like to mention is leadership, but not from the perspective of Kenneth. I will just focus on the overall leadership organizations and also individual leadership, in a way that either you are a pharmacist, a member of the pharmacy team, if you are another healthcare professional, just move forward with your idea to build trust, to start creating a network of people working together. And overall, instead of having a top-bottom approach, a bottom-up approach will also be very fruitful. So thank you, Ryan.
One thing I would add from the perspective here in the United States, I think as some of you may know, we have 50 different states with 50 different rules around pharmacy technician practice. And what we have actually seen in the last few years is that there are a few states here in the US that have changed their rules to allow pharmacists to delegate to a pharmacy technician any task that is within that pharmacy technician's education and training. Now, of course, there is still that list of things that pharmacy technicians cannot do, patient counseling being one of them, but it really has given pharmacists the flexibility to determine what it is they want their pharmacy team to be responsible for. And it goes back to what you said, Luís, about trust. Part of this is that it depends on the relationship between the pharmacist and the pharmacy technician in terms of what tasks they trust that individual with performing. And so, like I said, we've only seen a few states move in that direction so far, but it's a big shift from what we had just a few years ago, where most rules in states were very, very specific about a defined list of what pharmacy technicians could do. And so we'll see if that trend sort of continues here in the States. We did get a question through the Q&A that I believe probably is directed to Juny, which is, how do you maximize on communication skills, especially where you need feedback?
Yes, I understand this question is to me. I was reading that question and answer. Okay, so it's easy for while training a student. because we have a specific task and different learning outcomes for the program, and maybe they are getting involved in a particular activity through their participation in the activity or making them write the reflections and giving them feedback. It is very easy to do that during the training of a pharmacy technician. But when they are in the real practice, it is really tough. So when they are in real practice, we need to have some mechanism to get the feedback. So there should be pharmacists who are under whom the pharmacy technicians are working. They have to spend time to give feedback in improving the communication skills. So it's a collaborative work, and need to maintain the relationship with the pharmacists to get the feedback. And while getting the feedback, we need to be very open for receiving the feedbacks and to improve the skills. But it's very easy. We have the system through the formative and summative feedbacks are available during the modules in the college for providing the feedback.
Thank you, Juny, for sharing that. I wonder, is there either in your course or in real life practice, are there ever instances in the UAE where pharmacy technicians are supervising other pharmacy technicians?
Yes. There are institutions, for example, the hospitals like Cleveland Clinic. There is a hospital in Cleveland Clinic. There are pharmacy technicians. There are many pharmacy technicians because it is very automated. There are very nice clinics where many pharmacists and pharmacy technicians are working. And there are pharmacy technicians who are overseeing other pharmacy technicians over there. So there is a shift in these kind of things, and we are seeing pharmacy technicians supervising others. But it happens only in few or institutions. But most of the communities or hospitals, it is the pharmacy technicians are supervised by the pharmacists.
Thank you. Luís, I'm wondering if you could share a little bit more about, are there ways for the audience here today, if they're interested in any of the work that FIP is doing around interprofessional collaboration, are there ways that individuals can get involved in some of that work?
Thank you, Ryan. Yes, well, first of all, I'd like to share, I mentioned in my presentation, we do have a microsite under the FIP website focusing just on the FIP development goals. And under the topic number 8, working with others, we do have a lot of resources and information, as I mentioned, about education, science, and practice. That's point number 1. Of course, that we do have PTAC, so the committee that we do have pharmacy technicians involved, as well as other stakeholders. So that's a good way of people just getting involved. So maybe it's a tip I can give to Susan, who's actually going to wrap up at the end of the symposium, just to give a sort of a call for action for that, and of course to participate on our events, not only the online events, which I think it's important, and also our annual conference. And to be honest, just to come up with ideas, because of course we do our best. I think all of us in different levels of engagement do our best, but if people do have a specific need on their own practice, and probably the solution we can actually pinpoint somewhere else. So on a one-to-one approach, also just for a very specific topic, I think it's also relevant just to motivate everyone just to reach us. Of course, that we need to, sometimes we might not have the answer right away, but just to sum up, PTAC, events, and one-to-one, feel free to reach us. Right here to help.
Thank you, Luís. Yes, I'll echo involvement in PTAC is a great opportunity or a great place to get started.
Definitely.
Luís, there is a question in the Q&A, and then after this one we can wrap up. And I'm wondering, this sort of goes back to what you mentioned earlier about there being differences all throughout the world. And the question is what pharmacy technicians can and can't do in the pharmaceutical field. Do you have any insight to share there?
Well, as I mentioned previously, what we had, for instance, in the case with France, is very striking because there was a huge change. There was a huge shift, like 180% degrees when it comes to pharmacists and pharmacy technicians within the community pharmacy practice. We do collect information, but I'll answer in a very politically correct way, saying we do have the information, but you don't have it updated. And just please bear in mind that there's also this shift, this rapid shift that we're seeing everywhere. So I think for the pharmacy team, COVID was an opportunity per se, but it was also a sort of a trigger for something, so for some positive changes, and we're still surfing that wave of changes. So again, and to be very honest, it's very diverse what technicians can do. It's very diverse what pharmacists can do as well. And of course, we live in a era of information. We collect that information, that we do have that on our report. So I'll just ask the participants just to also check that out on the FIP website. It's also a good way of having people to access the FIP website, but it's very variable. And to be honest, we even have cases like in case of the US, you have mentioned that, Ryan, and Canada for sure, and we have federal states that not only the healthcare professionals' scope of practice is different overall, but also within the pharmacy team. So maybe if the question came as a sort of way of setting a vision for what's the best practice, I think sky is the limit. But there is bits and pieces all over the world just to have a very positive vision for the practice, I'm sure.
Thanks, Luís. So as we wrap up, I wanted to just ask each of you if you have one main takeaway that you want the audience to have from this session. Juny, we'll start with you.
Take-home message is it's definitely a teamwork. And the pharmacy technicians has to work collaboratively with the pharmacy technicians for the better outpatient outcomes. So there is no one is upper or lower. Everyone has to work together for the better patient care.
If I may, patients are counting on us. So please be bold, please be brave, move forward with your ideas, do your own thing. I think it's very important. Don't wait for anyone else, because we're seeing amazing, amazing projects and results done on a one-to-one basis. So I'm not sure if I was able to do that to motivate that for all of you, but please do that, and also use the resources that are available. We don't need to reinvent the wheel, just need very committed professionals. Just move forward with your own vision. Thank you, Ryan.
Thank you. I again want to thank Ken, Luís, and Juny for sharing their expertise with us today. And I think, as Luís said, the patients are counting on us. And our next session, I think, is going to be a wonderful example of the impact that the pharmacy profession, pharmacy technicians, pharmacists can have in the area of public health particularly. So thanks again. And at this time, we will transition to our second session of the day. All right, so at this time, it is my pleasure to pass things over to my colleague, Michael, who will lead our next session.
Thank you so much, Ryan, for that exciting session. Good morning, good afternoon, good evening, viewers and listeners coming in from all over the world. Welcome to this second session. This is part of the ongoing FIP digital events and our very exciting theme of working together for the future of healthcare. I think is something that is really coming out. We have another exciting session. My name is Michael Mungoma. I am a pharmacist in toxicology. I finished my studies in Pakistan and the Republic of Ireland. I'm also completing a study in counseling psychology. I'm also a lecturer of pharmacology and toxicology in the School of Pharmacy, Mount Kenya University, meaning I am a Kenyan actually. I'm also an editor of Pharmaceutical Journal of Kenya, and very passionate about consumer protection. I want to welcome everybody. We have a series of presenters today, and our session today, this second session, is going to highlight the expanding role of regulated pharmacy technicians again, focusing on the involvement in immunization services, as was put there, public health becoming important and critical in pharmacy service provision. The speakers that we have will discuss training, regulatory considerations, and best practices for integrating immunization services into the pharmacy workflow. And we've seen how important this synergy is in just making sure that the public benefits fully. They will also explore lessons learned rooted in the United States, United Kingdom, and Canada as 3 early adopter jurisdictions that have supported the increasing role of regulated pharmacy technicians in immunization services. So, what do we expect to learn today? Part of our learning objectives includes 1, recognizing previously known and new regulated pharmacy technicians' immunization roles described in published literature. We're also going to learn about recalling pharmacies and regulated pharmacy technician workflow experiences with implementing regulated pharmacy technicians in injectable vaccine administration roles. Thirdly, interpret changes to regulations for regulated pharmacy technician scope of practice that authorizes administration of injectable vaccines or other injectable medications. And then finally, consider lessons learned and best practices for integrating immunization services into pharmacy operations. So our program, this is going to be our flow. I'm going to be your moderator. And we have 3 speakers who are going to talk about 3 thematic areas. 1, pharmacy technicians, immunizations and beyond. That's Matthew DeMarco. The road traveled by pharmacy technicians in Great Britain, Alison Hemsworth. And results from a 2023 survey with US immunizing technicians by Kimberly McKinnon. And then we're also going to have a question and answer session. And I encourage you all to send in your questions or comments as we continue. And then after that, we're going to wrap up and conclude this session. We're looking forward to a very exciting session. First and foremost, we have our speaker, Matthew DeMarco. Matthew completed his entry-level PharmD degree at the University of Waterloo in Canada in 2011 and has practiced in a variety of community and hospital pharmacy roles over the last 14 years. Although spending significant time as an inpatient hospital pharmacist and critical care pharmacist in transport medicine, for the air ambulance, Matthew's recent work has largely been focused on primary care in chronic pain clinics, HIV clinics, and providing academic detailing education service for primary care providers on behalf of a non-profit government-funded organization that is the Center for Effective Practice. Matthew is also a research coordinator and graduate student at the University of Waterloo School of Pharmacy under the supervision of Dr. Nancy White and Dr. Sherilyn Hugh, where they are focused on expanded scope practices in primary care. So we want to welcome Matthew to take us through the session and his presentation on pharmacy technicians to immunization and beyond. Welcome, Matthew.
Huge thank you, Michael. And I'd also like to thank Ryan Burke and the many organizers for today's amazing program and FIP's Global Pharmacy Technicians Symposium. Just a sensational program that you've put together. Also like to open up a warm welcome to our audience for joining us today for the program entitled Pharmacy Technicians to Immunization and Beyond. And I'll be providing the Canadian context to this conversation. We can move on to the next slide. And Michael had already provided us our learning objectives for today, so we could move on to the next slide. Thank you. So predating the start of my work in this area in 2020, and a consistent theme since then, has been the increased uptake of community pharmacy vaccination services by patients owing to improvements in access and convenience. To meet the increasing patient needs, regulated pharmacy technicians practicing to their full scope was identified as an important intervention in the pharmacy practice literature. So that led our group to ask the following research question on the left-hand side of the screen. What is known about the roles of regulated pharmacy technicians in vaccination services? And with the accompanying objective of using a scoping review methodology to map the range, nature, and extent of the pharmacy practice literature. So since then, in 2020, when we started this work, fast forward to today, back then in 2020, there was only one country that authorized injection certified technicians to provide medications by injection in the USA, led by Dr. Kim McKiernan, who you'll hear from in just a moment. Today, there are now 17 countries that authorize regulated pharmacy technicians to provide vaccines by injection across low, medium, and high income earning countries, either through permanent legislation or still developing our temporary legislation. One of which is Canada, which brings us to the right-hand side of the screen, and the province of Ontario, where roughly 1 in 3 regulated pharmacy technicians are certified to provide vaccines by injection. Move to the next slide. So first, a little bit about the Canadian context. The increasing patient demands for vaccinations in Canada are characterized by government-collected data showing that pharmacies have provided an additional 7.9 million influenza vaccines over the last 5 years. And this is relative to historical averages of 2 to 3 million per year back in 2016, 2017, 2018, to now closer to 5 to 7 million influenza vaccines per year over the last couple of years. Community pharmacies in Canada have also administered 4.6 million COVID vaccines since 2021, with 15 to 20 million during 2021 and 2022 respectively, but more closer to 7 to 8 million during 2023, of which 70% were co-administered with influenza vaccines, and there are similar numbers anticipated for this fall and winter's respiratory disease season. Moving down to the second figure, the proportion of adults vaccinated in pharmacies has increased from 35% in 2018-2019 to now 57% in 2023-2024, which is suggested to be due to the growing number of jurisdictions across Canada that have authorized pharmacy professionals to administer influenza vaccines. Next slide. Like many countries, improving access to patients through community pharmacies is explained by increasingly broad geographical distributions of community pharmacies. In the province of Ontario, 63.6% of the population resides within one walking city block of community pharmacies, and 90.7% reside within a 5-kilometer driving distance of a community pharmacy. Community pharmacies' long hours of operation are also more accessible, with a recent study showing over a third of pharmacist-administered vaccines were administered outside of the usual physician office hours, including evenings, weekends, and holidays. In Canada, 9 provinces individually license and regulate pharmacy technicians, all with somewhat similar requirements to those in the province of Ontario that you can see in front of us here, which includes completion of a 2-year accredited Canadian college or university program, or recognized international program, completion of the Pharmacy Examining Board of Canada exam, completion of jurisprudence, ethics, and professionalism exams, proof of language proficiency, and Canadian citizenship. And more recently, as well, we have a practice assessment of competence at entry, which was just brought in this year to replace a structured practical training program that was found to be a bit more difficult to find training workplaces, in particular for international pharmacy graduates. As part of the practice assessment of competence at entry, down at the bottom of the final bullet point, we also have ongoing quality assurance when registrants are selected to either go through self-assessment, practice-based assessment, or proof of professional development portfolio. Move on to the next slide. So with that, the scope of practice for regulated pharmacy technicians in Canada, and Ontario more specifically, includes receiving a verbal prescription or transferring a prescription, performing a technical check on new or refill prescriptions, providing instruction on medical devices, providing non-therapeutic information to patients, remote dispensing under a pharmacist's supervision, compounding per protocol and beyond use dating, as well as conducting point-of-care testing. You can move on to the next slide. So across Canada, there are over 10,000 regulated pharmacy technicians, as described in this table, with our provinces going from top to bottom on the left-hand side, and a total number of regulated pharmacy technicians on the right-hand side. In the middle two columns, on the left-hand side, we see fairly equal distribution of uptake of regulated pharmacy technicians in community pharmacy practice on the left-hand side in the middle, and on the right-hand side for hospital or institutional practices. More specifically, the provinces that regulate pharmacy technicians are those that are colored in white, or white rows, in addition to the one blue row 2/3 way down the table, indicating the province of Ontario, Canada's most populated province, where over 50% of regulated pharmacy technicians in Canada currently practice. We move on to the next slide. The scope of practice for injection certified technicians is variable across provinces in Canada and still through either permanent or developing legislation, as we've discussed a couple times. So in this table, if there's a box with a white background and a blue check mark, that indicates more developing legislation to support this expanded scope of practice, whereas a box with a blue background with a white check mark indicates permanent legislation to support the scope of practice. And if there's a red background with a white X, it shows that there's no legislation to support this expanded scope of practice. So currently, in terms of which provinces authorize which vaccines, all 7 provinces that authorize regulated pharmacy technicians to provide injection authorize the administration of COVID-19 and influenza vaccines. So you'll notice British Columbia under influenza in the next iteration of this chart, given that they were the most recent to add developing legislation. We would expect a white background with a blue check mark showing some developing legislation to support that practice. In Ontario, the 5th province going from left to right, you can see that there's COVID and influenza administration that are supported by permanent legislation. But in the 3rd row, you'll notice a white background with a blue L, indicating limited injection authority to also include RSV vaccines as well. Moving to the right of Ontario and Quebec, we can see Canada's eastern provinces, New Brunswick, Nova Scotia, Prince Edward Island, Newfoundland and Labrador, all with dark blue boxes with white check marks, indicating permanent legislation for regulated pharmacy technicians to provide all vaccines under the supervising pharmacist's scope of practice, and which you can see the 14 preventable diseases by each province just below those eastern provinces within the pharmacist's scope of practice. Move to the next slide. So here is a summary of the 7 provinces that have temporary or developing legislation for regulated pharmacy technicians to administer vaccines. Once again, you can see the eastern provinces in the first row, where they have authority to have all pharmacist vaccine types delegated by a pharmacist for patients 2 years and older. Whereas in Ontario, patients must be at least 6 months to receive a COVID-19 vaccine, at least 2 years to receive an influenza vaccine, and at least 5 years to receive an RSV vaccine. In the province of British Columbia and Saskatchewan, we can see that patients must be at least 2 years or older to receive an influenza or COVID-19 vaccine. Also, you can see a very common thread across all provinces that injection certified technicians must complete an accredited training program and also complete CPR and first aid training. And also all vaccine administration across all the provinces must be done under the supervision of an injection certified pharmacist that they work with in the pharmacy. We can move on to the next slide. So when it comes to accredited training for certification, all courses are required to cover the following 7 competencies. So regulated pharmacy technicians must safely and effectively prepare and administer immunization agents and other substances by injection. They must implement Canadian guidelines when storing, handling, or transporting vaccines and other injectable substances. They must act in accordance with legal and high ethical standards. They must document information relevant to each immunization encounter in accordance with national guidelines for immunization practices and jurisdictional health information processes. They must anticipate, identify, and manage adverse events following immunization as appropriate to practice setting. and they must communicate effectively about immunization as relevant to the practice setting and apply relevant principles of population health for improving immunization coverage rates in accordance with pharmacists. Now, the format of the courses that are offered for this accredited training usually require a 4 to 5 hour self-study online module and accompanied by a multiple choice test that candidates usually need at least 70% to pass. And in addition to this, there's also an in-person training session where candidates will have an opportunity to practice their skills and techniques, as well as demonstrate an IM and sub-Q injection. We can move on to our next slide. Okay, so moving back over to that research question and scoping review objective I mentioned on one of my first slides, here you'll see a summary of the 14 included studies that describe 3 regulated pharmacy technician roles across 3 outcomes going from left to right across the top. So we have training outcomes, workflow outcomes, and patient care outcomes. The first role that was described at the top and the top left was a screening role that involved regulated pharmacy technicians taking patient information, as well as vaccine eligibility information, and identifying prospective patients for vaccination. Although this role had positive benefits, they were found to be a little bit inconsistent, most notably that they challenged the pharmacy workflow. Down at the bottom, you'll see a traditional role that was characterized as more of a traditional dispensary role in supporting vaccination services. And although training and patient care outcomes weren't really described for this role, there were positive impacts on the workflow. Most notably, in the middle, you'll find a group of vaccine administration studies that had consistently positive benefits. In particular, training outcomes in that the pharmacist and the regulated pharmacy technician were both comfortable and confident in the technician's training, and it also improved regulated pharmacy technician job satisfaction. Moving over to the right under patient care, there were positive benefits in increasing the number of vaccinated patients with no increase in adverse events or errors. But most notably were the positive impacts on workflow. With the uptake of regulated pharmacy technician vaccinators over pharmacists, we saw benefits of improved flexibility for pharmacists, improved pharmacist clinical time, as well as the overall workload distribution and task shifting across the pharmacy and sharing of tasks across the pharmacist and regulated pharmacy technician. It was also found to be easily integrated into the workflow upon its introduction. We can move on to the next slide. So this scoping review provided evidence of benefit with the effective deployment of regulated pharmacy technicians in the vaccination workflow. Pharmacy professionals advocated for this role, and particularly the vaccine administration role, owing to its workflow benefits, the pharmacist's clinical time, and pharmacy technician job satisfaction as well. Early adopters safely expanded vaccination service capacity, and future work within the scoping review called for evaluation of workflow models that included traditional roles and some of the newer emerging pharmacy technician roles, such as screening and vaccine administration, in addition to describing the roles of all the pharmacy team within that workflow and kind of putting it all together. On the right-hand side of the screen, you'll see the publication for the scoping review in 2022 in the Journal of the American Pharmacists Association. We move to the next slide. Okay, so moving over to subsequent project and accomplishing the future work discussed in the scoping review. So next we look to describe and explain community pharmacy professionals' vaccination workflow experiences by recruiting pharmacists and injection certified technicians that work together in community pharmacies in Ontario that had integrated an injection certified technician. And we wanted to ask them semi-structured interview questions that involve the following research questions. So how do pharmacy professionals accomplish roles and activities within the vaccination workflow? So who's doing what? What influences the vaccination workflow? And what are the impacts on vaccination workflow found with integrating an injection certified regulated pharmacy technician in community pharmacy practices? We'll move on to our next slide. So of the 10 recruited pharmacist regulated pharmacy technician pairs, 7 of them were from an urban area, 3 were from a rural, 4 were mass merchandisers, and 4 were retail chain pharmacies, and 2 were independents. Half of the pharmacies had less than 400 prescriptions per day. and the other half had more than 400 prescriptions per day. 9 of them had offered vaccination services for greater than 5 years, and all recruited pharmacies offered clinical pharmacist services such as medication reviews, as well as prescribing for minor ailments. Moving over to the participant characteristics between the pharmacist and injection certified technician pairs, the average age was 42 years, average practice experience was 14 years, and when it came to COVID and influenza vaccines, participants described a high volume period in between October and November, where on average they gave 84 vaccines per day and ranged somewhere between 18 to 120 per day. And during low volume periods from December to March, there was an average of 3 vaccines per day and a range of 0 to 5. We move on to our next slide. When it came to influences on the vaccination workflow, there's both non-operational and operational influences. Non-operational were more indirect influences such as head office support for human resources or technology, and were a little bit less measurable, yet still important. Operational influences were more measurable and variable, such as vaccination volume, pharmacy team member skills, service offerings, be it walk-in appointments or walk-in or appointment-based booking, staffing capacity, as well as dispensary needs being high and low dispensary volume. We can move on to our next slide. Across all 10 pairs that we interviewed, nearly all pairs described the following 2 models. The first one is called the high efficiency model and involved the pharmacy assistant taking on intake roles of completing consent and eligibility forms, completing order entry as well as vaccine registry and billing, as well as monitoring for adverse events and printing patient records as needed. The pharmacist in the high efficiency model was in a clinical role of performing clinical verification, answering patient questions, and treating adverse events, as well as supporting the staff with any questions that came up. The regulated pharmacy technician's role within the high efficiency model was to review eligibility and confirm product selection and administer vaccines. And so they mostly stayed in the vaccine administration room for continuous back-to-back appointments during a high volume day. Operational influences you see in the bottom left-hand corner that characterize this model were that there was continuous appointments using the appointment-based model, having available pharmacy staff, most notably the pharmacy assistant, and having low dispensary volumes on those days. Really key influence was having high vaccination volume for using this model. So this model was also found to be associated with increased vaccination workflow efficiency, and this was characterized by both using booking intervals of 5 to 10 minutes for each appointment, as well as the quotation you see from a pharmacist in the bottom right-hand corner of the screen. They, the technicians, were just sitting in that counseling room for 8 hours, just going to be injecting. We can move to the next slide. The second model described by almost all pairs was called the flex and protect model. And in this model, the pharmacy assistant was actually removed from the vaccination workflow and protected in the dispensary. The regulated pharmacy technician within this model adopted those intake roles of completing consent and eligibility forms, order entry, vaccine registries, and billing, as well as continued to administer vaccines, and also once again adopted some of those roles that pharmacy assistant was doing in the other model, such as adverse event monitoring and printing patient records as needed. The pharmacist role within this model was quite consistent to the high efficiency model, once again, performing those clinical activities of performing clinical verification, answering patient questions, as well as treating adverse events. So within this model, key operational influences that describe this model were that using intermittent appointment-based models or walk-in appointments, as well as having staffing shortages or having high dispensary volume. A really key influence was having low vaccination volume with using this model. And this model was also characterized to be associated with reduced vaccination workflow efficiency, as characterized by booking intervals for those intermittent appointments of 10 to 20 minutes, as opposed to that 5 to 10 minutes using the high efficiency model. And reduced vaccination workflow efficiency was also indicated by the quotation in the bottom right by one of the regulated pharmacy technicians. We get behind without an assistant. That way it was very difficult because when I was finishing with someone and coming out to get the new paperwork, then I would have to check on the people in the waiting area, give out their piece of paper that said that they had their shot, then bring in my next person. It definitely slows things down. We can move to the next slide. So workflow outcomes found from the semi-structured interviews in the second project that are, regardless of the model that were used, are characterized on this screen with the following 4 outcomes showing benefits. So first, we have an improvement in pharmacy professional motivations, as exemplified in the quotation in maroon in the top right. It gives you a pep in your step, and I say that in the nicest of ways during one of the worst crises we've probably ever seen in our lifetime. There are also benefits of pharmacist time and flexibility indicated in green in the bottom right, so both dispensary and clinical time improvements, and this is indicated also by the quotation in the bottom right. It definitely helped me a lot to do more clinical services and gave me time to answer questions and definitely helped with the overall workload. In the bottom left-hand corner in purple, we also see benefits in patient access, patient experience, and patient safety, as indicated in the quotation in the bottom left. It definitely allowed me to take in more appointments, take in more walk-ins, and it definitely reduced wait times and stuff like that. Last to mention is the benefit in the middle of the triangle of increased injector availability indicated in amber. And this is also indicated by the quotation in the top left by a technician. If I, the technician, wasn't able to jump in, there's no way we could have expected the only pharmacist or 1 or 2 pharmacists to drop everything at that moment and take a couple walk-ins. We can move on to the next slide. So conclusions of the semi-structured interviews in the second project were that regulated pharmacy technicians increased injection capacity and optimized team member roles based on skill and relative to those 2 models that we discussed that managed volumes while taking into account dispensary needs and patient needs. The second bullet, limited vaccination workflow differences were noted among pharmacists and technician injectors. So using a regulated pharmacy technician as the injector wasn't any faster or slower based on skill, and the pharmacist role was quite consistent across models, and also depending on what injector was used, it was consistent in being in that clinical role, performing clinical verification, answering patient questions, and treating adverse events. The main difference and the main exception was that there was differences in injector availability with using an injection certified regulated pharmacy technician, and this was also associated with improved patient waiting times and reduced interruptions. And this was actually most noticeable during low volume times when that resource or that injector is sometimes in a flexible role between the vaccination workflow and the dispensary. So future work indicated in our second project involving semi-structured interviews will be to quantitatively compare regulated pharmacy technicians with pharmacist injectors during that low volume as well as high volume time for respiratory disease season. We can move on to the next slide. So if we were to redo the scoping review today with the findings of the second project, in addition to any other published literature, there used to be only 5 studies that characterized vaccine administration, mostly completed by Dr. Kim McKiernan, whereas there's been 7 more studies now published. But if we were to redo the scoping review findings, we would find that project number 2 further affirmed all of those scoping review outcomes that were associated with the vaccine administration role as it relates to training outcomes, workflow outcomes, and patient care outcomes. But it also described new outcomes and new benefits that fall within these 3 buckets of outcomes. So in blue, we have some of those newer outcomes of pharmacist motivations and an improvement in professional identity for pharmacists in that they were able to focus on some of those clinical roles without interruption. As we move over to patient care, we see that there is description of cost-contained patient care as well as reduced patient waiting times. But most notably under workflow, we see that workflow efficiency of using the pharmacist versus the regulated pharmacy technician within the vaccination workflow specifically wasn't really any more efficient based on injector type, and that efficiency within the vaccination workflow is actually more related to the model that was used and having available resources to staff those models. There's also improvements in dispensary support and reduced interruption, and also, like I said, that key benefit of improving injector availability. We can move on to the next slide. So the remaining gap from the semi-structured interview study in our second project, more specifically, is understanding the impacts on vaccination appointment time with the use of injection certified regulated pharmacy technicians, determining how long it takes to provide vaccinations, including patient waiting times and interruptions, can help us better understand how to optimize roles and continue to support the expansion of pharmacy vaccination services and capacity and improve patient access. Next slide. So this leads us to our third project and research that has yet to be completed with the following research question. How much time is required for pharmacists and regulated pharmacy technicians to provide adult influenza and COVID-19 vaccines during high and low volume times in Ontario community pharmacies? And this is relative to the average overall appointment time and the average time for each vaccination workflow activity separately. And we look to accomplish this by performing a time and motion study. A time and motion study is the gold standard and most preferred method by healthcare providers to capture and quantify the time required to complete and accomplish a healthcare process involving the patient. Time motion studies involve using motion or auditory cues to time each step of a process and are ideal for processes that have relatively few steps, that are well-defined, that are within sequence, and hence you can see the vaccination workflow being a good fit for this type of methodology. We can move to the next slide. So our hypothesis for our third project are that there are no important time differences among regulated pharmacy technician and pharmacist injectors during high volume days regarding overall appointment time and for each vaccination workflow separately, and that pharmacist clinical consultation time between using both types of injectors. And this was indicated in project 2 by the use of dedicated injectors within high volume times. However, we do anticipate that there will be an important time difference among regulated pharmacy technician and pharmacist injectors during those low volume days, in particular as it pertains to those patient waiting times and interruptions to the vaccination workflow. Next slide, please. So how will we accomplish the time motion study? We're looking to recruit 2 pharmacies, both with a pharmacist injector and an injection certified technician injector. One pharmacy will represent a high volume time period for respiratory disease season and will include continuous appointments during the months of October and November. And the other pharmacy will represent a low volume time period using intermittent appointments, and it will take place between December and March of this year. Eligible injectors must be experienced in that they have injected at least 20 vaccines over the past 12 months that they worked. They must work together in the same pharmacy, and they must also be the main planned injector for the days of data collection. Eligible patient appointments will be adult patients that are receiving influenza and or COVID vaccines, and therefore, if any other combination of additional vaccines to COVID and influenza will not be eligible for the study, as well as family visits, or if there's any planned pharmacy services in addition to those administering those vaccines on those days, such as a medication review. The sample size was that we'll be looking for 26 patients within each group for each type of injector within high volume days, as well as low volume days for data collection. We can move on to our next slide. So what are the individual workflow activities that we're going to be looking to capture time for? First, there's patient intake, followed by a patient waiting period. After that, pharmacist clinical consultation, once again, is the only pharmacist only role, followed by vaccine administration, and then patient documentation and billing, followed by post-vaccination observation, and although rare, treatment of adverse event likely during the post-observation period, but also want to acknowledge the nuance with the fact that adverse events could occur before vaccine administration with the presentation of feelings of fear or anxiousness. Last, there's interruptions to the vaccination workflow that could also happen at any point within any of these steps. And also just want to acknowledge that there's some nuance with, let's say, when billing occurs within the vaccination workflow, and hence the individual steps that represent the workflow will be adapted to the pharmacies that we recruit and will be documented within an observation guide so that it's specific to the pharmacies that we work with. Next slide, please. So huge thanks for listening in for a moment and hearing about the Canadian context to this very exciting expanded scope of practice. We can move on to just the last slide in summary, and the impacts of this work include that it will significantly contribute to the limited existing pharmacy technician research in Canada and support further training and implementation. And by identifying strategies to enhance service delivery, best practice models for safe and effective vaccination workflow and patient care can be established, and identifying models that improve patient flow minimize interruption, and optimize the skill set of pharmacy professionals will ensure patients can access vaccinations conveniently, safely, and in a way that improves vaccination uptake at the population level. And I'll put my contact information into the chat box here. If anybody wants to further conversation via email, please, I invite you to contact me, and I'd love to discuss this research or future research and collaboration. Thank you.
Thank you so much, Matthew DeMarco, for that insightful presentation and very rich information coming out of the research that you've done in Canada. I'm sure there's a lot that people are learning. And I still encourage all the participants again, please send in your questions so that we can capture them, and comments at the very end, we can go through them. At this point, I want to bring in our second speaker. Our second speaker is Alison Hemsworth. Alison is a pharmacy technician with nearly 40 years experience, so 4 decades. She's an expert in English community pharmacy policy and has led national roles in that space. She's currently undertaking a full-time PhD looking at public health roles of the community pharmacy workforce in England and France. Let's welcome Alison to take us through her presentation. Welcome, Alison.
Thank you very much for that introduction. Can you all hear me?
Yes, we can. Go
Okay,
ahead.
thank you very much. Okay, if you can move on to the next slide, Ryan, please. So I'm going to be talking to you a little bit about vaccination services delivered by pharmacy technicians in Great Britain. I'm going to tell you first of all a little about who I am, why I'm presenting. I've got some more discerning learning outcomes for my particular presentation. Throughout the presentation, I've put in extended learning resources, and obviously there will be questions at the end. Next slide, please. So, as Michael's already said, I am a pharmacy technician. It's fair to say that compared to most pharmacy technicians, I've had a very unique career pathway. I've had several national roles in England, and also some very high-profile roles in the local environment where I live. I'm literally just in the last week gone into the second year of my PhD, and my research title is the Public Health Roles of the Community Pharmacy Workforce in England and France, and it will be a mixed method study. And the objectives of that study are to analyse the context shaping the professional activities of the community pharmacy workforce who deliver public health services, to establish how the community pharmacy workforce makes sense of and enact the rules and guidance for public health service delivery, to explore the current educational and training attainment of the community pharmacy team members who deliver these services to the public, and to appraise where there might be gaps in education and training of the community pharmacy workforce, which act as a barrier to service delivery. And to be clear, I'm looking at the whole community pharmacy workforce, not just the regulated workforce. Next slide, please, Ryan. So, as I've already said, my last national role at NHS England, I was the head of primary care policy for pharmaceutical services for the whole of England. And my responsibility was to write new policy, develop existing policy. I negotiated that policy and I implemented it within community pharmacy services in England. So both my biggest claim to fame, for want of a better phrase, and also consistent with this presentation, is that I'm the person that's responsible for introducing, on behalf of the NHS, vaccination services in English community pharmacies being delivered by pharmacists. And that happened in 2015. And so between 2015 and last year, over 12 million vaccines have been delivered in community pharmacy, flu vaccines have been delivered in community pharmacy in that time. So I'm really proud of that statistic. And obviously, what I'm going to tell you fits very well with my research that I've just described. Next slide, please, Ryan. So in this context, it's going to be really important for you to understand the difference between what is Great Britain and what is the UK and why it's important to this topic. I'm going to talk you through the legal mechanisms enabling vaccinations in the UK. We're going to talk about the impact of the COVID-19 pandemic in opening up the vaccination services to pharmacy technicians in the UK, and to recognise that delivering vaccination services is just the beginning of the clinical journey for pharmacy technicians in Great Britain. Thank you, Ryan. Next slide. So you'll see two very similar maps there of British Isles. The one on the left is Great Britain. So Great Britain incorporates England, Wales and Scotland. And the one on the right is United Kingdom, and there we add in Northern Ireland. And the reason that this is important is that in legislation, in Parliament, in 1997, Scotland and Wales decided that they wanted their own parliament, and Northern Ireland followed suit in 1998. And certain things within legislation have a devolved nature, and health is one of them. So each of those parliaments have their own legislation existing around health. And in particular, so Great Britain, the slide on the left, have made arrangements for pharmacy technicians in Great Britain to be registered healthcare professionals. That hasn't yet happened in Northern Ireland. They are very nearly on that journey, but it hasn't yet happened yet. So things that can happen in Great Britain can't happen in Northern Ireland, and therefore can't happen in the whole of the UK. So it is quite an important distinction. Next slide, please, Ryan. So pharmacy technicians in Great Britain are a regulated profession. So to reiterate, that's England, Scotland and Wales. And being a pharmacy technician is a protected title in statute, which means you can only call yourself a pharmacy technician and work as one if you are on the General Pharmaceutical Council's register. Anybody that calls himself a pharmacy technician that doesn't have that status in the register is effectively breaking the law and can end up in prison as a consequence. So the register first opened voluntarily in 2005. And it became mandatory in 2011. And as of the middle of this year, there are now 26,621 registered pharmacy technicians in Great Britain on the register, which is just less than half the number of pharmacists. So you can see that we're quite relatively small in number. The roles of pharmacy technicians have progressively expanded since mandatory registration in particular, and most especially in the managed or hospital sector. But until last year, that hadn't really happened in community pharmacy. Northern Ireland is in the process of introducing registration. It has now been agreed. They're just waiting for that legislation to pass through its own parliament. But when they have, that legislation has been enabled, then pharmacy technicians there will be able to perform the same activities as their Great Britain counterparts. Next slide, please. So, a little bit about the legal routes to access to vaccines in the UK. So the vast majority of flu vaccinations in the UK are given in primary care, and to contextualise that for you, by that I mean a GP practice and or a community pharmacy. And using prescriptions to access the vaccine would not be efficient. You can imagine how many, millions of prescriptions would need to be written. So a prescription isn't necessarily the most efficient way in order to get the vaccine to a patient. Since 2006 in the UK, pharmacists have been able to train as independent prescribers. But in reality, only hospitals have really taken advantage of that so far, mainly due to the ability for funding issues. So, for example, if a community pharmacist wants to prescribe independently in primary care, they have to get permission from their local GP practices to tap into their prescribing budgets. So as you might imagine, that doesn't happen very often at the moment. However, from 2026, all newly qualified pharmacists will be independent prescribers from the day they enter the General Pharmaceutical Council register. But because of the millions of people involved, it still won't be the most efficient way to deliver flu vaccination. Next slide, please. So we've also had, for quite some time, a process called patient group directions, or PGDs for short. PGDs identify a group of patients, so in this example, those who are eligible for a free flu vaccination, and allows registered professionals from a statutory list to supply or administer that medicine to those eligible patients. And the key phrase there is statutory list. So the actual profession needs to be listed in that legislation in order to be able to work under a patient group direction. So similar to independent prescribing, pharmacists have been on that statutory list since 2006. Pharmacy technicians were only added in June of this year, and I'll talk to you a little bit more about that in a moment. Next slide, please. However, we also have something called patient-specific directions, and this in effect is a way for a prescriber to delegate the administration or supply of a medicine, usually administration, to somebody else. But the patients must be named, so it's akin to a prescription. It's incredibly unwieldy, and in a primary care setting creates tensions around funding streams for vaccinations. So because most community pharmacists aren't currently prescribers, if they wanted to use PSDs in community pharmacy, they'd have to get the GP practice to write all those PSDs, and it needs to be one per patient. And because GPs get paid for flu vaccinations, as do community pharmacists, then you can imagine that GPs don't really want to be writing PSDs for other people who are going to, in their eyes, effectively take that funding stream away from them. However, in a GP practice, for example, they tend to be used to enable non-registered staff, such as healthcare assistants, to administer medicines, or for those healthcare professionals who are not listed in the PGD legislation. So they're a little bit of a halfway house. Next slide, please. However, all those three solutions, when it came to the pandemic, created a problem. Because it wasn't going to be enable mass vaccination at the speed that needed to happen during the height of the pandemic. So across the UK, we introduced a new type of legislation called national protocols. Originally, it was just for COVID vaccinations, and then it spread to flu vaccines as well. And so within those national protocols, there are roles for registered healthcare professionals and non-registered healthcare professionals. And it enabled the process to be split in a similar way to what Matt's just described during his presentation. The clinical assessment needs to be done by a registered healthcare professional, and the administration can be done by the non-registered health professional. And in a mass vaccination setting, that worked really, really well, because the patient could go into one room to be consented and assess for suitability, and then literally move to another room for someone to administer the relevant vaccine. It doesn't work in a community pharmacy where they only have one consultation space, and so most community pharmacists did not use this national protocol, and they stuck with just the pharmacist delivering the vaccination by the patient group direction that we've just already spoken about. And interestingly, pharmacy technicians were originally an anomaly with the national protocol, because whilst they are a registered healthcare professional, if they had been enabled to undertake the clinical assessment and take consent for the patient, that would have been contravening the patient group direction legislation. And so in this particular instance of national protocols, they were treated as a non-registered healthcare professional, which, as you can imagine, caused some consternation. Next slide, please. So, however, we are progressing towards pharmacy technicians working towards patient group directions. But as that picture on the right-hand slide shows there, it's a bit like an iceberg moving. So 2014 was the first time that the NHS England in particular started a process to enable pharmacy technicians to work to patient group directions. It took until 2017 for a case of need to be submitted to the relevant governance panels. And in 2020, a paper was submitted by the Association of Pharmacy Technicians UK to the relevant stakeholders, outlining the urgent need, and the timeline of that won't go amiss when you realise that that was in the middle of the COVID pandemic. There had in 2016 been a recommendation that pharmacy technicians should be able to work to patient group directions, but by 2020 hadn't been acted on, and therefore caused more problems with mass vaccination centres than would have been necessary if that recommendation had already been acted on. It took until 2022 for an announcement that a public consultation on pharmacy technicians working to patient group directions would be in the public domain, and that consultation took place last year. And I'm delighted to announce that as of June 2024, it became a reality that pharmacy technicians can now work to those patient group directions. Next slide, please. So anybody vaccinating in the UK of any nature must be able to meet the national minimum standards and core curriculum for immunisation training for registered healthcare practitioners. And that is a hyperlink there. So when you get these slides, you will be able to read that document for yourself if you wish to. Next slide, please. So I'm just going to give you an English example here, because this is where I'm at my forte, because this is my English policy is my expertise. So to be able to deliver a flu vaccination, whether you're a pharmacist or a pharmacy technician, you must have completed a document called the Declaration of Competence. And that Declaration of Competence works you through all the training that you need to complete in order to be able to deliver flu vaccination or a COVID vaccination. So first and foremost, they must have undertaken training in consultation skills delivery. They must be up to date with their safeguarding knowledge, because that's a compulsory requirement for all community pharmacies in England. They must understand who is eligible for a vaccination under the NHS. They must be able to consent the patient for the vaccine. They must have practical and theoretical knowledge about vaccine administration. They've got to prove that they can work with and understand the documentation that's available. They must be able to treat minor and major adverse reactions, including handling anaphylaxis, and for that they have to undertake specific anaphylaxis training. They have to demonstrate that they're aware of safety issues like handling of waste medicines, or if they're going out to do a domiciliary visit, maintaining the cold chain. They must have knowledge of the relevant patient group direction that's overseen, which is the legal enabler for the particular vaccine that they're going to give. They must have the relevant pharmacotherapy knowledge. And if they are going to go and deliver domiciliary vaccinations or off-site vaccinations, then they also have to undertake additional training to make sure that they understand all of those things as well. So that's just to deliver the flu vaccination service and or the COVID vaccination service. But in addition to that, pharmacy technicians in particular now also need to undertake training to enable them to use that new legislative enabler of the patient group direction. So between those two sets of training, we're probably looking at about 12 hours worth of training. Although we don't work to continuous hours of education in the UK, we work to continue professional development, and so it could take somebody less time than that or longer time than that to actually complete all that they need to do in terms of the training. Next slide, please. So in a community pharmacy in England, in the pharmacy itself, the vaccination must take place either in a consultation room, and it is compulsory for all community pharmacies in England to have a consultation room, or in an alternative area that meets infection control standards. Even if it's a pharmacy technician that's vaccinating, currently the pharmacist must be on the premises, and that's because of our supervision rules here that says medicines can only be given out and administered in the presence of a pharmacist. However, we have an ongoing consultation about the supervision of staff in a community pharmacy in particular, and we expect the outcome of that soon. So that, depending on the outcome of that additional consultation, it may change in the future that the pharmacist doesn't need to be on the premises to oversee those vaccinations. And indeed, Wales and Scotland have already taken a different view on that, and the pharmacist doesn't need to be on the premises in those jurisdictions. Domiciliary vaccination can occur, again, provided there's a pharmacist in the pharmacy. Whether it's a pharmacist or a pharmacy technician, they need to make sure that their personal professional indemnity covers them to give vaccinations. The service must be accessible to everybody, so it can't exclude any particular part of the population. They need to attend face-to-face training periodically to relearn and refresh their memory on how to give the vaccination, the anaphylaxis training, and etc., etc. And they are advised, all vaccinators are advised that they should maintain a portfolio of competencies, particularly if the regulator comes to visit and they want to know that the staff are as competent as they say they are. And as I've already said, the training must meet the national standards. So similar to what Matt's just said, most community pharmacies in England are booking patient appointments for flu vaccinations every 5 minutes. Actually, they can take walk-ins as well, but they can only vaccinate adults currently because the vaccination of children is usually overseen by school nurses. Next slide, please. So our overarching title for this set of presentations was Immunisation and Beyond. And the presence of patient group directions provides the potential for pharmacy technicians in Great Britain to supply and or administer other prescription-only medicines. So, for example, in Wales, they've already announced that pharmacy technicians in community pharmacies will be able to participate in their contraception service from February of next year. I think that will follow suit in England too, but that announcement has not yet been made. For those that want it, therefore, in the future, pharmacy technicians, the role will definitely be clinical. They will still be able to undertake those leadership and managerial roles if they wish to, but if they want to follow the clinical route, the fact that we can now work to patient group directions massively opens up those doors to that. I must stress that each service that requires the administration or supply of a prescription-only medicine does require its own patient group direction. And the pharmacy technician will need to demonstrate that they can work to each and every single one of those with whatever training is relevant for that particular service. So it's not as simple as doing the training once. They will have to do the training for every single service. So we do still have, as I've said, the supervision rules in the UK in terms of working under the supervision of a pharmacist. But it's fair to say that the pharmacy technician profession in the UK has an ambition for us to be autonomous practitioners, and the rollout of patient group directions is certainly the way to start that conversation. Thank you very much for listening.
Thank you so much, Alison, for sharing your experiences in the UK, and very, very insightful as part of your work, your PhD work. We want to swiftly move to the next speaker, Kimberly McKinnon. Kimberly is a PharmD, BCACP. She is also a professor of pharmacotherapy and director of Center for Pharmacy Practice Research at the Washington State University. She's also a PhD student at Nelson Mandela University. Dr. McKinnon is passionate about research involving pharmacy practice and public health. Welcome, Kimberly, and please take us through your presentation. Welcome.
Thank you. Thank you for the introduction, and to my colleagues who were presenting earlier. It's just so fascinating to hear what's going on in other countries and, our similarities and differences. But it's always so heartwarming to do these presentations, because I think it's, we see that we're all working together. We're maybe in different places along the journey, but we're all in this together, and that always means a lot to me. So thank you. My name's Kim. I'm a professor in the United States, and have been pretty involved with technicians immunizing in the United States since that began. I'm going to give you just a little bit of background in this, and then I'm going to dig into our results from a 2023 survey that we did with pharmacy technicians who have already been immunizing for multiple years. Next slide, please, Ryan. Thank you. So just, I promise not to take too much time on the history side, but just a little bit of background, and you're going to hear some similarities and some differences with my friends in the UK and Canada. But pharmacists have been immunizing in the United States since the 1990s. And so it's quite commonplace here and has been for as long as I've been in practice. And I'm proud to say that it's some of my colleagues at WSU who were involved in that effort early on at that time as well. And so pharmacy technicians have been vaccinating in the United States since 2017. And I can tell you a little bit about that because I was involved in the initial development of the first training program for pharmacy technicians in the US, designed specifically for them to teach them how to immunize. That started in one US state, the state of Idaho, in 2017. And so we developed that training program at WSU, and we trained about 600 technicians in a span of about 3 years. And I'm very proud of that work, and it's been a pleasure to collaborate with some colleagues at WSU on that. But as we know, something was on the horizon. COVID was about to happen, and some really neat things happened right before that to allow this to expand in the United States quite rapidly. So in 2019, we started having conversations with the American Pharmacists Association, who saw the training program that we had created and some of the early research, which I think Matt shared a little bit of that in his presentation. But anyway, they were interested in partnering with us, acquiring the training and making it available to pharmacy technicians across the United States. I finished those slides in about February of 2020. I remember at that point we were just starting to have conversations in the US about, oh, COVID is coming. We were having our early cases, and so we feel, it's just amazing to me the timing that worked out so well with that. But in any case, we went from my program, which trained about 600 technicians in the span of 2.5 years, to we have now trained 139,000 pharmacy technicians to immunize. And that's just this program with the American Pharmacists Association. There are many programs that teach technicians to immunize in the United States. And many of the state associations have their own programs and some different universities. So that number underrepresents what's actually happening here. So I'm super proud of that and all the work these technicians are doing in the United States during COVID. I actually just Googled this while I was listening to the presentations. The data that I found, and this is a little bit old, but according to the CDC, as of August 2023, so this is more than a year ago, 307 million doses of COVID vaccine were given in pharmacies in the United States. And I can't tell you how many were pharmacists and how many were technicians, but we know that technicians were a huge part of this activity. So again, it's just super proud of the work that's been done in the US around this. So I want to tell you just a little bit about a survey that I conducted with my colleagues at the American Pharmacists Association. And I want to note that this research was possible because of grant funding, and that was from the Merck Investigator Studies program. And I also have a link here on the site if anyone's interested in learning more about the training program. The link is there. But I will say, after listening to Matt and Allison, it's very similar to what you described in terms of the training, the level of competency required, must have a hands-on injection technique portion. So if anyone's interested, you're welcome to check that out as well. Next slide, please. Thank you. So for the survey, we sent this out in 2023, and this is part of a larger project, but I wanted to make sure that we had plenty of time to talk about the work that my colleagues are doing, because I think it's just phenomenal to see the progress that's happening. So I'm just going to tell you a little tiny bit about this bigger project, and hopefully that will kind of pique your interest, and maybe you'll be interested to learn more about this in the future. So in 2023, we sent out a cross-sectional survey that I developed with my colleagues at WSU and at APHA and some external folks that I'll note toward the end as well. And we sent this to immunizing pharmacy technicians, specifically 6,000 technicians who went through the WSU APHA training program. The folks from APHA sent this out via email, and we had Institutional Review Board approval to conduct this survey. And there were several domains that we wanted to look at. One is just advanced technician roles in general. So in the US, immunizing is not the only advanced technician role that pharmacy technicians can undertake. There are several more. I encourage you to talk to Ryan Burke from PTCB if you're interested, because he has a wealth of information about that. But we wanted to know advanced roles in general. How is this impacting pharmacy technicians, and to some extent on a personal level? Because we want to know, we talk about the important work that pharmacy technicians are doing for the world, but I think it's also really critically important to think about how does this impact pharmacy technicians as people and as healthcare providers as well. So we had some domains in the survey that were looking at job satisfaction. Were the technicians happier in their role, feeling more fulfilled, and feeling more like an important part of a healthcare team by doing this, or had it turned into kind of one more thing that they had to do in the community pharmacy? We also looked at camaraderie and workflow. So was this having a positive impact on those elements as well, or was this creating, I don't know, bottlenecks or different challenges? I think Matt talked about that a little bit as well, that kind of figuring out how to optimize this does take some art and science to it. And then we also wanted to look at, of course, immunizing. So were they giving more immunizations? Do they feel that they're giving, their pharmacy is giving more immunizations as a result of technicians being able to vaccinate as well as their pharmacist colleagues? And what was the impact on vaccine hesitancy? I hypothesize, and I do not have any data to support this yet, but I hypothesize that pharmacy technicians are often more culturally and linguistically representative of the communities that they serve than their pharmacist colleagues. I've observed this time and again, where a pharmacy technician in a pharmacy might be the only person who speaks the language of a local population. So obviously in the US, we predominantly speak English, but there are so many languages spoken throughout the country, and often it's a pharmacy technician is the one that speaks, the language. It's not necessarily the pharmacist. So in any case, I wanted to see, do they believe that's true? And then also, what impact does that have on things like vaccine access and vaccine hesitancy? Because if there's one person in the pharmacy you go to that speaks your language, and that's the person who's asking you if you're interested in being vaccinated, that may feel like quite a different conversation than if it's someone that you're not as familiar with or that you don't understand as well. So a lot of different domains, but I'm going to share just a little bit of data with you over the next couple of minutes. So next slide, please. And so here's some results to share. Yep, I'm sorry, I built the animation into this. So first we wanted to know, what percentage of the immunizations are given by a technician. I had heard some criticism of this early on, saying, well, are the technicians even really going to be vaccinating, because it's going to be up to the pharmacist to decide whether that is a task they're willing to delegate or not on an individual basis. And the technicians that responded to our survey, I should say we had just under 300 respondents, which was what our power analysis was set for, a 5% response rate. So that was very close to what we were after, just shy of, but nearly there. And so the technician respondents said, 34% of them said the majority of the immunizations in the pharmacy are given by a technician, and 45% said at least half. And I apologize for the typo on that slide. I noticed that this morning. And so we have nearly 80% of the respondents say at least half, and perhaps larger amounts than that are given. The vaccinations in the pharmacy are given by the technician. So I think that really speaks to the success of this, that not only, are we training technicians to do this and changing practice so that they're allowed to do this, but they really are doing it. And then another question that I had, that again, in the earlier days, I had some concerns about this. Do you feel supported by your pharmacist to give immunizations? Because unlike kind of what Allison was talking about, where a pharmacy technician would be added to a list, and then they have the authority to do this, here it is a individually delegated task. So the pharmacist at that day in that pharmacy gets to decide, do I want to support technicians to vaccinate or not? And in the earlier days, I did have some hesitancy among pharmacists about this. And so 80% of my respondents said they did feel supported by their pharmacist to give immunizations. I'm sad that's not higher, but it's a start. Next slide, please. Oh, sorry, more data. And then, as I was talking about earlier, looking at this really as pharmacy technicians, as people, has your job satisfaction increased since you started immunizing? Because I did start to have some concerns, is this going to be just one more task that the technicians have to add to their plate to do in their roles? And 64% of them said it increased their job satisfaction. So again, I wish that number was higher, but I do feel like that's a positive thing overall. Next slide, please. Thank you. Sorry for the animations built in. Just a little bit more information to share with you about this. So one of the things we wanted to know was, what were the factors that led into the pharmacy technician deciding to become trained to vaccinate? So were these financial incentives, which we knew to some extent that there were those, because in the United States, as the COVID vaccine was about to come out and we're looking at, having to vaccinate every citizen of the country, there were financial incentives from large pharmacy corporations that we were hearing about for technicians to go through the training and to become immunizers and begin immunizing. So I was actually surprised that number wasn't higher as well. But we asked, so why did you decide to become trained to administer immunizations? And about a quarter said they wanted to learn a new skill, and another 12% said they wanted to build their CV. So I thought that was pretty great, because I've known some really phenomenal pharmacy technicians who sort of hit the ceiling of what they're able to do in the United States, and then kind of get bored over time, because their choices are, do I want to go to 4, 5, 6 more years of college to become a pharmacist, or do I want to keep doing what I'm doing? And I've known some really wonderful ones that have decided, I'm bored, I'm going to go to a different profession. So I love this learn a new skill piece. We also have 16% who wanted to obtain an advanced role. Like I talked about, there's several options for advanced roles. 15% said assist with the workflow or workload, and then 13% said they were financially incentivized by their employer. And again, I was really surprised actually that wasn't higher. But among that 13%, we asked them if they would be willing to share what the financial incentives were, because we were hearing that this was happening but didn't have any data. And so about 40% said their employer paid for the training, and then 32% said they received a one-time bonus. And I know this was happening during COVID. I don't know whether it is currently or not. And then 15% said they received a wage increase. Next slide, please. And I promise I'm almost done. I'm only doing just a little bit here. Okay, and then one of the questions that to me was a big one: do you believe that properly trained technicians should be allowed to immunize in all U.S. states? This was critically important because during COVID, pharmacy technicians were allowed to immunize under a federal act that superseded the policy in all U.S. states. So in the United States, each of the 50 states has their own rules about what pharmacy personnel are and are not allowed to do. And it was only a handful of states at the beginning of the pandemic that actually were allowing technicians to administer immunizations. The PrEP Act, the Federal Emergency Readiness and Preparedness Act, said, nope, during COVID, everyone's allowed to vaccinate as long as they've met the training requirements. And again, very similar to what was described by my colleagues. So one of the questions that I had is, as we look at the PrEP Act rules, actually, they end December 2024. So this is right around the corner. How do pharmacy technicians who immunize feel about this? As this is starting to go away and we're back to state-by-state rules, what do they think? And 90% of them said, yes, they thought technicians should be allowed to administer immunizations. And I will say that nearly all, I think we had one holdout, nearly all U.S. states either have legislation in place that has changed since 2017, or they are working on it, that hopefully technicians will continue to be allowed to administer immunizations following all the rules that are in place around this. I'll give you an update on that the next time I present something. Next slide, please. I think that's about it because I wanted to try to keep this short, but I did want to acknowledge some of my collaborators. So some folks from WSU and the American Pharmacists Association, and then Ken Hohmeier and Shane DeSalle, who are faculty at other universities, but have great expertise to share on this topic. And I'd also like to thank the Merck Investigator Studies Program because, again, this wouldn't have been possible without the funding that they gave us to do this work. Next slide, please. I think that might be about it for me. Here is my email address. As you can probably hear as I'm talking about this, it's a topic that I feel very passionately about. So if you're interested in having conversations around this, I'm always looking for new collaborators within and outside of the United States who are interested in this work. So please don't hesitate to reach out if you'd like to talk more about this. And I think that is it for me. Thank you. I will turn it back over to Michael, and hopefully we'll get some questions here.
Thank you so much, Kimberly. And again, we've had three very good, insightful speakers talking about the work they're doing with the pharmacy technicians. And clearly, there's quite a lot of synergy in what is being done. It's just being able to consolidate that and really, put in that affirmation and confirmation that we really need to work together. The workforce is working, I would say, and in the area of immunization, which is becoming even more increasingly important with everything that is happening worldwide. And we are now in our Q&A session, and we encourage people to keep sending in their questions. I know I haven't, there are a few questions that have been answered, but maybe just to ask something. I know I know there's something that Kimberly said there that was really important. How technicians were able to speak their local language, are able to engage some of the clients better and the community better. And I was just wondering what that means in terms of just training generally the pharmacy workforce, and including a very strong component there of language and communication skills, and how that can impact the overall, public health pharmacy space. Maybe you can make some comment around that.
Yeah. And so again, I don't have any data to share, but I think more studies need to be done on this topic. And it's, here in Spokane, we actually have a pretty good sized Russian speaking population. And at the handful of pharmacies that I've worked at, there will be one technician who speaks Russian and none of the pharmacists do. And so you can imagine how much those patients value that person. But to your point, Michael, I think it really speaks to the importance of communicating with those patients, and pharmacy technicians being trained ideally as students to practice those pieces as well. I will say I think the rules are a bit different in our three different countries. Here in the United States, pharmacy technicians are not allowed to do anything that would be considered to be clinical judgment. So it still has to be the pharmacist saying, yes, this vaccine is safe and appropriate for you. But that doesn't mean a pharmacy technician couldn't spark the conversation with the patient and first say, are you interested in being vaccinated today? Do you know of any vaccines that you'd be interested in getting, and get that going, to have that conversation with the pharmacist to get kind of their approval. And I think, Allison, I heard I think we have different rules as far as this goes, because ours here, it's entirely supervised. The technician must be supervised, and a pharmacist must be physically present for them to be able to immunize, but just in general, in practice. And here it's the clinical task that the pharmacist still is responsible for, and the technical task that we can delegate. But can you speak to those pieces in the UK?
Yes, certainly. So certainly in terms of what you've just said about the pharmacy technicians and other support staff mostly being the people who can speak the language of their local population, I think that's the same in England, certainly. There has been some debate within English healthcare policy about whether that's the right thing to do, or whether they, in fact, community pharmacies should be given access to formal translation services, like GPs are. And there have been a few pilots where community pharmacies have been given direct access to translation services, mostly on the telephone. And those pilots are now being evaluated, and we'll see what happens in the future. But certainly at the moment, so we've got quite a few pockets of the UK where there are high numbers of people who speak an Asian language, and that reflects the population, and we tend to draw our pharmacy technicians and our pharmacy support staff from the local population. So similar to what you've described, it does currently happen. In terms of that clinical judgment, so if a pharmacy technician works under that patient group direction that I've talked about, then they are enabled to assess whether the patient is eligible for the vaccination and to formally take consent as well. But they must have done all that particular training in the first place. What I meant to say and forgot to say previously was that patient group direction legislation is an enabling legislation. It's not mandatory. So if a pharmacy technician doesn't wish to get involved in that, then they don't have to undertake that training. There may or may not be a bit of a dichotomy there if their employer wishes them to do it and they don't. But there's nothing in statute that says they have to at the moment. But it is, so it's an enabler. I did ask, so there is a main training company who is commissioned by NHS England to provide this type of training. And I did ask them for some statistics on the numbers of pharmacy technicians that have gone through that relevant training. But because that law was only enabled in June, it's a bit difficult, it's too early to get those statistics yet. So a bit like you were saying, hopefully in the future, I'll be able to give those. And I think it's important to say that there's only about 5,500 pharmacy technicians working in community pharmacies in England, and we have around about 10,500 community pharmacies in England. So not all of them employ a pharmacy technician. So I think our model under that patient group direction model is a bit of a hybrid between what you've described and what Matt described in terms of his, I can't remember what you call them now, but high workflow. I can't remember what terms you use, Matt, but you understand what I'm trying to say. So that it's, because this will be the first season when they've been able to vaccinate under that particular enabler. Then we need to sort of pull. Well, if anybody decides to do some research on it, because that's the other thing in the United Kingdom, we're very bad at doing research about pharmacy technicians, let alone by pharmacy technicians. So hopefully we will get some research and then start to pull that data out.
No. It's really, I think it's really, I totally agree. And the more we keep discussing, the more we keep bringing out data around pharmacy technicians and what they really do, we feel those gaps and we're able to look at, areas where we can actually improve what they do and support, the overall, pharmacy provision, especially in the community. Matthew, do you have maybe something to add on just based on your experience and what we're saying?
Yeah, definitely. Just wanted to add that thinking about the lens of culture and regulated pharmacy technicians working in different communities, I think that there's just immense potential with the fact that they may have the ability to change the concept of receiving a vaccine through being able to be from the community. And I think that there's a huge amount of importance around developing further interprofessional education as well as research around being able to access that. And we look forward in the upcoming years to being able to look into that potentially a little bit more and discover that potential, because I think that the sky's the limit once we are able to unlock that.
Yeah, thank you so much. Now, there's something else I also picked up from, I think, Alison's presentation, and it talks about, I think you described the requirements, having a consultation room, and maybe just to share the experiences here, what would be the overall sort of impact on the running business costs. Because with a consultation room, it means that you have a space that ideally should be utilized very well and maybe consistently. And do we have enough clients to support the consultation room, or is it something that is also maybe used for other purposes? I think it's something interesting, especially in different countries where it is a requirement, but people think about really how much does it cost to set up these additional space. Maybe Alison, you can share your experience.
Yes, certainly. So that requirement for a consultation room has again been on its own long journey. So in England, we have a framework called the Healthy Living Pharmacy Framework, which was originally designed to be a business change tool and wasn't mandatory. And that it was first enabled in legislation in 2009, and there was a bit of a research-led pilot undertaken to understand how that worked and if it works, and indeed it does work and works very well. And the idea being there was to enable community pharmacists to be able to deliver health promotion and public health services. And as I say, to begin with, here's a framework that you could utilise if you wish to. And the first level, it was meant to be over 3 levels, but the first level was about here's a training that we expect your staff to go away and undertake, and then you will be accredited to be a healthy living pharmacy. And when you've got that accreditation, local authorities will they'll be able to commission you for certain services, whether that be, for example, emergency contraception, flu vaccination, all those types of services. Like any framework and every time you set out an intention, it morphs along the way. It's had a really long journey, and from 2016 onwards was primed. So we got to between 2009 and the end of 2015, and something like, I'm trying to remember the figures here, but that less than 5,000 pharmacies had gone down that route, but it had been proven to work through research. And so in 2016, NHS England primed the rapid uptake of those other pharmacies that hadn't gone down that line, and they were given, dangled a carrot, do X, Y, and Z, and you'll get more money in this particular year. And it flipped so that something like 98% of pharmacies at that point were then accredited to be a healthy living pharmacy. And to be a healthy living pharmacy, you had to have a consultation room. So when it had flipped that far, we then made it mandatory for all community pharmacies to have a consultation room. There is, for now, this might change in the future, but there is a bit of a proviso so that if your pharmacy is too small to put a consultation room in, you can ask for a waiver on that legislation, but you do have to, demonstrate that you've at least thought about it. But in terms of, is it used enough to warrant the costs? Then absolutely. So not only are they delivering vaccination services, community pharmacies are undertaking blood pressure monitoring services, including ambulatory blood pressure monitoring services. That's all done in a consultation room. All the supervision of opioid medicines now is done, to wean people off opioid medicines and street drugs is all done in the consultation room. The contraception services need to be delivered in the consultation room. So the way people have been encouraged is the service specification over the years has said you can only provide the service if you've got a consultation room, and therefore people have put that consultation room in order to be able to reap the benefits financially from those services, because they have to have it in order to be able to deliver those services. And we've 2 years ago, we introduced a service called Pharmacy First, covers 7 minor ailment conditions, and the pharmacist can give medicines via a patient group direction again for those 7 common conditions, and that all has to take place in the consultation room. So with it being flu and COVID vaccination season at the moment, what's actually happening is contractors are saying, I actually haven't got enough space in my consultation room because I've got all these people coming for a vaccination. GPs are pushing people my way for that minor ailment consultation, and we're being encouraged to take people's blood pressure as well. The savvy ones are going, sit down, have a flu vaccination in your right arm, and I'll do your blood pressure on your left arm while we're at it. And that's permissible. But yes, they're absolutely being used very well.
Yeah, thank you so much. I think it's very interesting that we can actually have so much being done in those consultation rooms and really expand our services and create reason for collaborating with other healthcare workers and getting them to appreciate what can be done there, even if it's triaging and so on and so forth, and being able to get all these kind of clients and patients coming in. Yes, and well, I think we've actually done quite well. I think we've done 1.5 hours now. And maybe at this point, I really want to really appreciate the 3 speakers and how you've been able to really articulate and bring out very, very important and useful points. I would totally say that even the participants and the listeners have taken in quite a bit. And importantly, you've also shared your contact so that this conversation can keep going. At this point, I want to say thank you very much for everyone listening in and having taken time just to participate in these FIP digital events. And say bye and hand over back to Ryan. Ryan, am I handing it over back to you? Thank you.
Yep. Thank you so much, Michael. Thank you, Alison, Matt, and Kim for sharing your expertise. We are going to have some closing remarks in just a moment. But before I do that, I want to just mention that the recording of this event, as well as future digital events, can be found at events.fip.org. And also let you know that plans are underway for the 83rd FIP World Congress in Copenhagen, Denmark. And in January, abstract submissions will open for those of you who may be interested in presenting there, and you can see the timeline on the slide here. So we want to again thank you for attending the past couple days of the Pharmacy Technicians Symposium. And before we wrap up, I would like to hand things over to Susan James, who serves as the chair of the Pharmacy Technician Advisory Committee, to provide a few remarks and close out today's session. Susan?
Thanks very much, Ryan, and very interesting. I'm not sure why for this particular symposium, my video camera seems to work when I get started in the day and has decided that it won't work when I need to speak to everybody. So my apologies, but I'm glad we have a photo at least. It's probably a better photo than the way I look right now. So you can take a look there and see who's speaking to you. I want to start with just saying thank you so much to everybody who has been involved in providing, listening, engaging in what I believe has been a tremendous, successful Pharmacy Technicians Symposium. Those of you that were here yesterday will have heard that this is the 4th time that we have done this virtually. We used to do these in person as a part of the FIP World Congress, and we've actually found that this has been a wonderful transition because it is something that is accessible much more broadly. We have had tremendous engagement in the last few years, and so we're really delighted with that. And it has also allowed us to move the timing of this particular symposium to coordinate with the World Pharmacy Technician Day, which I trust everyone knows was yesterday. We offered our congratulations and thanks to all of our pharmacy technicians at that time, and that's part of the benefit of moving to this format. I want to particularly thank you, Ryan, for moderating much of our symposium, as well as being the person behind the scenes that really was masterminding program development and organizing everything to get us here. So thank you so much for your leadership in that regard. We've heard tremendous presentations from all of our speakers yesterday and today. If you are just joining today as our second day of the symposium and were not able to attend yesterday, I certainly do encourage you to go back to the FIP website and take a look at the recordings from yesterday's sessions. We had a couple excellent presentations, one that was talking very much about the workforce in various regions and understanding how artificial intelligence is included in that, sort of the impact of artificial intelligence, some specific presentation on that in terms of teaching related to AI, as well as just understanding the importance of the data that comes, sometimes through AI and is used to contribute to how we develop the workforce in various regions. Yesterday's session also included what I think is one of our very popular sessions that we do, which is to present some unique pharmacy technician roles. And I have to say that all of the presentations include speakers that have unique roles, but it is a session that does highlight 3 particular speakers that have particular backgrounds, differences that are not as common, and I would encourage you to listen to those as well. I think what I'd like to say in terms of closing and as I reflect on what we've heard and our theme for the whole session, there's a couple things. First off, we've had a lot of conversation about the workforce, recognizing the important role that pharmacy technicians and other pharmacy support personnel, pharmacy assistants play in terms of the workforce. And you've also heard and many people will know, we've heard from various speakers about the concerns about the supply of the workforce within their various regions. This is something that we know worldwide, the World Health Organization, very aware that there are concerns about the sustainability of our workforce, the great demands of the health needs globally, and do we have enough workers to be able to fulfill the needs of our patients globally? One of the things that we've been hearing about is the significant way that we can ensure we have full use of our workforce by having each of the individuals, healthcare providers, working to their fullest scope. And for pharmacy, that means that a pharmacy technician or an assistant who is able to contribute fully what they have to offer will allow the pharmacist and others to meet the full scope of their role as well. And that is a very, very important mechanism for ensuring that we have workforce needs met. We have seen that globally. It often has been the driver for the development of pharmacy technician roles, for the regulation of pharmacy technicians, or any other authority mechanisms that are being used in various regions where there is a shortage, a supply issue, then that's particularly we do tend to see the drive towards further scope. The pandemic is just another example where we saw such demand from our patient population, from our public population in that regard, where everybody needed services and pharmacy was able to come into play and recognized as just how valuable it was, particularly for its accessibility in all regions. And that is the other driver, and you've heard particularly this last session on immunization, just how the need of patients can also drive up the requirements, the workforce need, and the roles that we have to offer. As we think about that and thinking to our topic, relationships in all of that activity are so important. The ability to work together. You've heard throughout our session about the collaboration that is needed. In many cases, it's a required collaboration, a supervision that is required. But more importantly, and I think to our earlier session today, the very valuable information that we heard about the nature of that collaboration, the importance of the recognition of each other, of the skills of pharmacy technicians, the ability of pharmacists who are working with them to work in a way that is respectful and engaging and transformative so that again, we can have success, satisfaction by everybody that is engaged, and promote, again, that workforce collaboration. And I guess the other thing, part of our title is looking to the future trends, and I can't help but reflect on just the successes that we have been hearing about, the number of different places, opportunities for pharmacy technicians and for pharmacy as a whole to step up and to meet the needs, and I think certainly to be well prepared for where we are going in the future. So with that, I am going to conclude our session. I do want to put a plug in. One of our earlier speakers commented about how can individuals get involved, and I do want to once again let you know that this symposium has been hosted to get engaged. I would also encourage it as they would like in any of the areas as an individual member. Certainly you have access to all of the resources. Most of those are available regardless, but it does give you opportunity to participate in some of the different initiatives that are involved. The Pharmacy Technician Advisory Committee as a group is certainly called on. We are recognized as an important contributor to so many of the projects that are underway at FIP. And so the opportunity for us to be able to contribute to provide the perspectives of pharmacy technicians and other support workers is really critical to the work that FIP is doing as well. So with that, please don't hesitate. Look up how you can become a member at FIP, and know that we also welcome membership into the Pharmacy Technician Advisory Committee. That's just a matter of sending us a note, letting us know that you would be interested in participating. And I note that we include pharmacists and pharmacy technicians. We recognize the importance of having both members of the profession working together, collaborating within our own work. So while we certainly want to make sure that we have pharmacy technicians who are there to provide their perspectives, it is equally important for us to be working collaboratively with the pharmacists. And you've heard so many pharmacists through the last couple of days that are themselves very committed to working and supporting the advancement of pharmacy technicians. So that's the way we work at the Pharmacy Technician Association, or the Pharmacy Technician Advisory Committee. With that, I will conclude. Once again, say thank you to everybody. And I will say we will look forward to seeing you next year at the same time in conjunction with World Pharmacy Technician Day. Thanks very much for your attendance. Bye for now.